Good evening, or good morning, everyone. Welcome to this special school board meeting, September 2nd, 2021. Before we begin the work of the district, we will stand for a moment of silence, followed by the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Mrs. Luke is going to be a few minutes late. She's stuck in traffic. I just received a text, so she'll be running in here in just 1 second. We'll begin with 2.01, Superintendent.
Oh, good morning, board. Good morning, guests. Thank you all for being here this morning. And I also want to say good morning and welcome to the many folks who I know are joining us on TV today, as well as Zoom. So we're going to jump right into our agenda this morning for the purpose that we're all here today. And I just want to begin with the obvious. I am an educator. And so what I'm going to do this morning is I'm going to do a little teaching. In Lake County schools, we believe that all students should know what they are learning and why they are learning it, and we call this establishing the purpose. So today I'm going to start with the purpose. I'm going to give you some information. We're going to look at some data together, and then I'm going to present to the board a recommendation to amend our safety protocols using a data-driven approach to help mitigate the spread of COVID-19 in our schools. My best hope for us today as a school district and a community is that, first of all, we all listen with an open mind. I know we are not going to reach consensus. This is a very divisive and an emotional issue. But my goal is to provide you information on what we're dealing with as a community and a school district, and then make a recommendation to the board that I know not everyone will agree with, but one that I'm hoping that we can all live with. So I'm going to start by reminding everyone that currently the Governor's Executive Order number 21-175 remains the law. And given that the board has voted by majority to adhere to this law, I will not make a recommendation that asks the board to violate the law on which they've agreed to stand. So as I said, we're going to start with our purpose for today, and the purpose is to ask the board to approve recommended changes to our district safety protocols. This approval will allow us to initiate a risk-based, data-driven approach to help mitigate the spread of COVID-19 in our schools. This approach is surgical. It is targeted. It is not wide-sweeping or universal, but seeks to implement a long-term and sustainable system designed to protect the health and safety of our children and staff, while keeping our schools open, reducing positivity rates, and reducing the number of students in quarantine. The system addresses schools whose positivity rates are considered as high risk for transmission without a one-size-fits-all approach. So I mentioned quarantines, and I'm going to start there because this is the thing that has caused the most angst in our schools and in our homes and in our community. We know that the numbers are alarming and they are very concerning. Our teachers are also concerned and our students are concerned. And we have seen, as I said, an alarming number of students in quarantine. And you can see those numbers here. But I will note that this is the trend across every school district in Florida and across our country. Everyone is concerned about these high numbers and our mostly healthy students that are being sent home and out of school in the extended period of time, for an extended period of time, and many of them multiple times. Going into quarantine, coming back, going back into quarantine. And we are concerned about the valuable loss of instructional time and the disruptions, again, to our classrooms, our schools, and to our homes. I mention this because I want to remind everyone that there is an emergency rule that was issued by the Florida Surgeon General on August 6th, that addresses specifically who and when a student or staff member must quarantine. This is the current law for contact tracing and quarantining that we are required to follow. Yesterday, Ashley Moody, Attorney General, issued to all of us an advisory opinion that districts cannot depart from this law. The State Department of Health has told us which tests we can use for asymptomatic and symptomatic staff and students to return to school, and this has been confusing, but there are some new tests that have been approved by the Department of Health, and parents will now receive a new, more user-friendly, understandable letter to help them with the quarantine guidelines. But there is hope. So on September 15th, the new Surgeon General is expected to consider as one of their first priorities amending the current emergency rule and addressing the growing concerns of the high number of students going in and out of quarantines and this learning loss happening when students are out of school. But for now, we have told that we must not vary from the emergency rule, knowing that by mid-September, hopefully we will see some revisions to tackle this issue. So we're going to look at some data. I meet weekly, sometimes daily, 3 times a day, with officials from our Lake Department of Health, and they have provided me some information that they wanted me to share with you all today to start our data conversation. So here's what the Lake Department of Health has reported that we are seeing in Lake County. Notice that this goes back to March when the pandemic started to the present. I'll give you a minute just to look at that. All right. So then I asked them, what are we dealing with today? What did the month of August look like for us? And you can see the number of total cases. You'll see the number of cases in kids 5 to 18.
Let me get somebody to you.
The number of kids ages 5 to 12. You'll see that there have been 0 deaths in the month of August of anyone under the age of 18 out of a total of 160 total deaths. And there's been 1 student hospitalized in Lake County for COVID. And then you see the average number of cases and the average number of total deaths of those of other age groups. What they also told me to share with you is that we do see hospitalizations going down and that we have seen no student deaths, but more kids are getting sick. So I've also spent the last several days talking with local health officials, including the CEO and our chief medical officers of every hospital that serves the residents of Lake County. And I've received guidance in the development of my recommendation from the CEO of the Children's Unit for Advent Health and their epidemiologist. And I will tell you more about that guidance in a few minutes. But here's what every one of the folks from our hospital said. Hospital admissions are beginning to level off. The local risk remains high, and they attribute that mostly to the low vaccination rates. The rate of infections are starting to decline slowly. I also heard them say that hospitalizations for children are declining. There remains a steady trend in the number of students or children receiving treatment for symptoms in the hospitals and local clinics, however. And I think every one of them started with a statement that our hospital staff is exhausted, and how do we as a community support them because they're tired. And I can tell you we understand that fatigue because you ask our teachers, you ask our staff, our administrators, who many of them are here today. Everyone's tired. I know as a community, we're tired. This has been a long ride. One of the hospitals did reach out to me again this morning and said, I want you to have the most updated data from our hospital. And they did want me to mention that, again, they've seen 0 pediatric patients and 0 ICU patients currently. I'm sorry, 0 pediatric inpatients and 0 ICU cases currently in that particular hospital. And they've seen 8 non-admitted cases. This is, again, in children. So in addition, we've looked at our data school by school. We've looked at it week by week. And we're noticing some things that we found enlightening and things that I've discussed with our local health officials. And I want to share those findings with you today, and I want to talk about what we're dealing with as a district, and based on my conversations with those health officials, what we're dealing with as a community. So here's what we've seen in Lake County in our school system. We see a wide range of positivity rates from school to school. We have positivity rates that range from less than 1% to above 8%. We've seen positive cases from week 1 to week 3 increasing significantly district-wide, but again, varying greatly from school to school. I think that, as I mentioned to you when I began about this being a targeted approach, this information that we've collected, I just want to tell you, it certainly supports a targeted approach to reduce the positivity rates within our schools and combat the issues that we're facing within our schools and within our community. So everybody has a copy of a data sheet. So again, we're going to do a little teaching today, so if everybody pull out a piece of paper, pull out your data sheet. If you don't have one, raise your hand, and somebody will bring you one. And while you're waiting, if you'll just take a minute if you haven't already, and just peruse that data sheet. For those of you who are at home, you are able to view it on the screen above. I know the numbers are a little hard to read. Might have to get out your glasses on that one. And if you are on Zoom, you're not able to see this unless you are on the live stream. So I would encourage you to maybe, if you've got another device, to look at it on that screen. All right, everybody have one? Board, everybody got your data sheet out? Everybody's got one, all right. So let me just explain what you're looking at. The data sheet provided is based off how many students and staff tested positive ending last Friday and the previous week, so it's a 2-week look. The totals are the numbers of students and the number of staff who tested positive for the weeks of August 16th through the 27th, as well as the total student and staff population that was used to calculate the positivity rates for each school. We'll reference this data again in a minute, but if we could go back to the presentation. Because I'm going to use this data sheet to set some context for us today. And as they're switching back, I just want to remind you what you're looking at is a snapshot. It's a sample that will help to support the recommendation. So again, here's some context for what you're looking at. Hopefully, as you look at it, you've noticed some similar trends. You've noticed that the rates vary from school to school. You'll notice that the rates vary from week to week within a school. And given the wide range of positivity rates, I would ask us as a school district and as a community, does a one-size universal approach make sense? So I liked this analogy. So if the fire alarm is going off at Treadway Elementary, we don't evacuate the students at Beverly Shores, but we react to the alarm at Treadway. So if you look at your data sheet, we can see that the alarm has gone off at Treadway Elementary School. They have a positivity rate of 8.27%, and the positivity rate of Beverly Shores, however, has remained at less than 2%. According to the number of sources, including the Lake Department of Health and its communications dating back to last year, the goal within a community is to have no greater than a 5% positivity rate and be able to sustain that rate for at least 14 days. So think of our schools as an individual community of learners. What we know is that COVID is a very fluid situation, and it is a plan that is surgical and data-driven, allows us to quickly respond to needs within a school and ensure that a plan is easily communicated and is easy for people to understand. A plan that addresses both short-term emergencies as well as long-term needs. So I just want to mention one of the things that why I think a sustainable plan is the right move is because we think about these ideas of these short-term 30-day issues, 30 days, 60-day, 90-day mandates that we're seeing. 30 days from now, what's going to happen? We're all going to be back. We're all going to be having these same conversations. We're all still going to be arguing. However, if we have a plan that is fluid and addresses the fluidity of what we see in the way that COVID is moving, we're not back here in 30 days discussing this again. We have a plan that is in place, and heaven forbid, 8 months, 10 months, 12 months, we see another variant, and our kids are getting sick again. We have a plan that's approved by the board, should they choose to approve this today, that we can immediately put into place. One that our community knows, one that our community understands, and no one has to worry. No one has to wonder. All right, so y'all ready for the recommendation? That's why we're here, right? Board, you have a copy of the recommendation in front of you.
We're getting ready to have it. Just 1 second. We're getting ready to have it in front of us.
Getting ready to what?
We're getting ready to have it in front of us.
Okay, I'm sorry. As I worked with some of our local health officials in putting this together, the word that they most often use while you're looking at it was, "This is very intriguing." I'll take that. I'll take intriguing. I'm going to read this to you as a read aloud, again, in our educator mode. I am recommending that the board amend our district safety protocols as follows. To help control the positivity rates of COVID-19 in our schools, we will implement a risk-based, data-driven system that allows for a targeted rather than a sweeping approach. When the positivity rate of the staff and students within a school meets or exceeds 5% of the school's population over a 2-week period, the school is identified as red. Schools between 3 and 4.9% are identified as yellow, and those below 3% are identified as green. On the last day of the school week, the data will be compiled from the current and the previous week. When a school is identified as red, the school and district will then notify all students, parents, and staff that they are in red, and that masks will be required when staff and students return to school on Monday. However, because the governor's order currently remains in law and prohibits a mask requirement, schools in red will have a mask requirement with a provision for a parent opt-out. To initiate an opt-out, a parent whose school goes into red will send a letter to the school principal stating that they are opting their child from the mask mandate. Students without a note from a parent will be expected to wear a mask. Schools will stay in red until their positivity rate drops below 5%, and those rates are maintained for a period of 14 calendar days. The school will then move to yellow or green, and the mask protocol will return to being strongly encouraged. Students in those schools without an opt-out will be expected to wear a mask on the school bus and while indoors. Masks are not required when outdoors, and masks are required regardless of vaccination status. Pending any changes to the law that would then give the board the authority to implement a mask requirement, should a school move into red, masks will be required and a medical opt-out will be accepted. Medical exemptions signed by a licensed physician will be honored. Those with medical exemptions from the 2020-21 school year will not need to obtain another exemption form if they can produce a copy of the form from the prior year, and most of our schools have those on file. If the law changes and only a medical opt-out is permitted, parents who do not want their child to wear a mask will have the option to work from home for the period of time it takes for the school to reduce their positivity rates below 5% and sustain that rate for no less than the 14-day calendar days. These students will be able to complete assignments through Google Classroom with assistance through Lake Assist. Students will not be counted as absent as long as they are completing their assignments. Parents seeking admission to Lake Virtual School for the remainder of the semester can submit their names and contact information to the questions at lake.k12.fl.us website. Some will contact you for help in placement at Lake Virtual School for the remainder of the semester or school year. Parents can also enroll in virtual learning options of their choosing offered outside of the school districts through home education. Students, staff, and parents will be kept informed of their school's status so that as a school community, everyone can work towards the goal of reducing the positivity rates and keep schools from moving into the red. Should a school's positivity rate continue to rise in spite of these protocols, the superintendent will work with school leaders and guidance from the local health department to make a decision regarding the closures of classrooms in our schools in a final attempt to reduce and control the spread of COVID-19 within a school. I am asking the board for approval to amend the safety protocols as described above. Before I take any questions from the board, I want to mention again that I've had amazing support from the CEO of the Children's Unit at Advent Health, Dr. Raj Wadhawan, and their epidemiologist, Dr. Vincent Hsu, and both of them said that I could mention them by name this morning. And Dr. Wahan gave me permission to use his quote. He said, "My first and best recommendation will always be in support of universal masking. However, given your data, I agree that this is a good approach to maintain safety using data to drive your decision-making process. It is simple and it is reasonable." And one of them said that they were probably going to share this with others.
Okay, so before we ask questions, you've heard the recommendation. Do I have a motion?
So moved.
And a second?
Well, I'll give the second so we can bring it forward to ask questions and things, but it looks like the action on this is going to be taken after public input. Is that right?
That's correct.
Correct.
That's correct. But we just need to make sure we needed to even talk. Excuse me? Can you go back one slide, Superintendent?
Oh, I'm sorry.
And then I think actually.
There's just highlighted a few key pieces of the recommendation. So one of the things I do want to mention, every health official that I talked to said that they do expect that we will see a dramatic decline very shortly. They said probably within a three-week period. They said this looks like a 6-week spike. They've said that we've peaked. You're seeing that in the data that I shared with you from our hospitals and from the Department of Health, and that they think that this will come down very soon. So again, if indeed they are right, and we're hopeful that there are, this would be a very short-term implementation, and hopefully our schools will remain in green. We'll get them there sooner rather than later. But then again, we'll have a plan should we need it moving forward in the future. So that is certainly something that we're all very hopeful for.
Okay. Go ahead, Mrs. Luke.
Can you clarify? Can you clarify the plan? The paragraph that says students will stay red until their positivity rate drops below 5%. And those rates are maintained for a period of 14 calendar days. The school will then move to yellow or green, and mask protocol will return to being strongly encouraged. Students in these schools without an opt-out will be expected to wear a mask on the school bus and while indoors.
School's in red, so
In red.
we need, yes.
Okay, that was confusing to me.
Okay, we can certainly clarify that language. Thank you. So I want to take you back, though. If we go back to our data sheet, because I did mention I wanted you to go back to that. And remember, it's a snapshot. So if you were to approve this plan, what we would do is take the positivity rates for this week. School's still in session today, so we don't have any final numbers for this week. We'll take this week's positivity rates, combine them with last week's positivity rate, or numbers, I'm sorry, of students, yes, students testing positive, and calculate the positivity rate. So if this were, now this is, again, a sample, so this is not what we would be looking at potentially. You'd see 6 schools that would move into the red, and we would be notifying them before Tuesday that the mask requirement is in place. We'll tell them how they can opt out if they choose to do so. But I want to mention to you as well, as we think about the fluidity of this, so Ms. Crosby, the principal at Eustis Middle School, is here, and she and I were talking about her data this morning. And this whole ebb and flow, and I talked to our health department, they said really what you're seeing in schools is it's the community spread that trickles into the schools. And we see that very clearly, which is why this one-size-fits-all approach, I don't believe is the right approach, simply because we see spikes within communities. We've seen, for example, she told me, I think it was, that she had 38 positive students last week, and this week she has 12, and she has 0 currently any teachers who've tested positive this week. So again, it flows into the community, it flows into the schools, and it moves back out, hopefully at rates that are quickly sustainable. So if we were to take her data, more than likely, now I haven't looked at it, she hasn't seen today's numbers, she would be coming off of the list. So that's just an example of how fluid this proposal would be as it addresses the community needs as well.
Mr. Chairman, I have a question.
Yes, ma'am.
Mrs. Cornegie, the paragraph right underneath the one that Mrs. Luke asked for clarification, could you give us clarification on that one? The one that speaks to schools moving into red and medical opt-out only.
So again, this provision clearly states that this is only an option should the law change, as long as the current law remains in effect. But I wanted to have a plan in place, again, so that we're not back here talking about it if the law were to change, that we have an approved plan. So schools in red, and I'm trying to find which paragraph we're on.
It's the second one from the bottom on the first page.
Pending the changes. But we give the board the authority to implement a mask requirement. So again, if you're approving this plan, you would be saying that with the law changes and you have the ability to enact a mask requirement, that we would move to this plan, and those schools that move into red would have a mask requirement with a medical opt-out, and that they would remain in red until they sustain those positivity rates below 5% for the period of 14 days, which is the recommendation. And then they would be able to come back off of the list. So again, you're on the list, you're off of the list. And the sooner we can get the positivity rates, and we as a community and school come together to say, let's work on this. We got to get the positivity rates. Our kids are getting sick. How do we work together to reduce that? The quicker we can get them off of the list. And I do, one thing that I always say about why I love this place and this community is everyone rallies and cares about our kids. And I have no doubt that if the fire alarm goes off at one of our schools, people are going to rally and they're going to support our schools. And we have these fabulous leaders with great respect within their communities to be able to say, if we all come together, if we'll all just do our part for 14 days, that's all we're asking, we can hopefully get our numbers below 5%, and this won't be an issue for our community.
Thank you.
So I think my question about this one, and I'm not sure that this is a question yet, but I guess I'm pondering the transparency of that particular piece, that I guess the board is then making a decision today kind of on a hypothetical of, okay, if the law changes, now there's this mask mandate in place without an opt-out except for medical purposes. But I'm not sure that we had communicated that one adequately to the public, because I think most folks are under the impression that we're not making any decisions today. And this one goes beyond the any parent opt out. I don't know. I guess my question is, do we feel like we adequately told the public that we were going to potentially make a decision today that, I thought we were waiting for the judge's order to be in place before, I was not under any impression that we were going to make a decision on masks or no masks, with really no opt-out, except for medical purposes today.
Okay. Well, certainly, again, the recommendation is fluid. If the board would decide that you want to strike that paragraph and bring the protocol back once the law changes, we can certainly do that.
If the law changed and that paragraph needed to be discussed again, it would still be under the temporary 2-week protocol, correct? Like everything else would stay the same.
That would be my recommendation, yes.
So it wouldn't be that we're mandating masks permanently. It would be
Correct.
under this coded system of red, yellow, green, correct?
For only those schools that needed it.
Okay.
I guess I'm a little confused with where we got the percentages from, because like schools aren't a community, so are these percentages the right thresholds? I mean, I know where we got these percentages. I just mean, where do we get the thresholds?
So we did, I had lots of conversation about that and went back to, if you recall last year when the pandemic started, that was the community goal. It was that we get to below that 5%. That was the threshold. If you look at, we've tried to look at articles and consults, if we go to the World Health Organization, other organizations, they all have the 5% for 14 days. And so we were looking for a threshold that made sense. And if we look at our data, we kind of aligned that threshold to what we've seen worldwide as well as across the country. The recommendations seem to always land back on that 5%. I did talk to the epidemiologist, talked to the Department of Health. They felt like that was a reasonable threshold, knowing that that was always the goal. And I do see our schools as individual communities. They're, we call them that. We call them school communities.
There's so many more kids pushed into a small area. That's why I was asking.
Yeah.
But if they approve that, that seems reasonable. So my other question is, given that masks are preventative, and that most counties that have done a mask mandate with parental opt-out have, I think Orange County has a 5% parental opt-out. If it would make sense to have your green, I don't know, some other threshold where, if Eustis Heights has, or not Eustis Heights, Eustis Elementary has 2 kids. Maybe they don't need a parental opt-out, but I would wonder if we want to have masking with parental opt-out at some higher threshold to prevent them from getting to the 4% and 8%. Do more preventative. I guess that's a question for the board. Because that is within the law. Let's see, at fourth paragraph?
I think that the fact that we're trying to establish norms that are based on data, in fact, that the 5% is from the World Health Organization, correct?
That was just one of many that you can find that I relied more on some of the local guidance on that.
So local also suggested 5%.
Why wouldn't we prevent it?
They felt like that was a reasonable threshold.
Why only?
Okay. I would stay at 5%. Okay.
So my next question is about just ease of I guess, administration and all these papers that schools would be expected to process if this plan were to go forth. Because it looks like the parents would physically write a note and send that in, right? So then is there an easy Google form that the parents could just click and approve at that point?
We did talk about that, and I don't recall that we established whether the principals, we talked about that. If we decided on the form or the written notice, I'll have to establish those protocols. That was maybe an optional if they wanted to just use the Google form. We did talk about that.
If there aren't any other questions immediately, why don't we begin public input then?
Okay.
And I'd like Mrs. Owens, if you can come up. And maybe this is also a chance, since we did this presentation first, for y'all to kind of process and give us some feedback to what you heard. That'd be great.
Good morning, Mr. Chairman, Superintendent, board members. Wanted to just make sure that the public understood that we are accepting public input today in 3 different ways: in person, virtually, and by email. If you have filled out a public input card and now, after hearing the presentation, have decided that you no longer wish to address the board, just indicate your decision when your name is called. If you do wish to speak, you will be given 3 minutes to address the board from the podium. If you have joined us via Zoom and wish to speak, please click the raise your hand icon in the Zoom platform. The moderator will unmute your line when it is your turn to address the board, and you too will be given 3 minutes to address the board. When calling speakers to give input, Chairman Matthias will alternate between speakers present in chambers today and those participating via Zoom. All emails that were sent to the public input email address have been shared with the superintendent and the board. The positions represented on those emails collected prior to the deadline of 4 p.m. on yesterday will be read into the record during this public input portion of the meeting. And Chairman Matthias will take it from here.
Okay, again, our school board policy is 30 minutes. However, we're going to extend that to 1 hour and 30 minutes. Everyone will have 3 minutes. And it's amazing to look out here, and this is the process where we will learn as well. I would ask everyone in the room, if you differ with the person that is speaking, merely let them speak and be quiet. If you support them, then I certainly would encourage that you show support, but just not the opposite, okay? So now then I'll get the cards. They have been stored in a mayonnaise jar at Funkin' Wagnalls, so I've not seen these. And we'll begin with Stephanie Dukes.
Thank you.
Excuse me, I can call the next one since we have 2 places, so if they're all right. Wade Lopez.
Apologies, it's Lotes, but I'm going to give you some education on that too as well. Thank you.
Sir? I'm sorry, I didn't hear you.
My last name is actually Lopes. I believe last time when someone did mention my name, they said Lopez, but I want to share some education with you all. It's actually Lopes. Thank you.
Okay, very good. Okay, go ahead.
Thank you. On March the 11th, 2021, the American Rescue Plan was signed into law. The plan provided Florida school districts with $7.4 billion to help open schools safely and meet students' academic and health needs in response to COVID-19. When we say masks save lives, what we're saying is this issue would not be an issue if these questions could be answered in the affirmative. How much of the $7.4 billion that Lake County received and was adequately applied for proper ventilation of our schools to help mitigate the spread of COVID-19? How much was used for personal protection equipment? How much of these funds were used to employ support systems for emotional and social needs related to COVID-19? The list I could go on, but I only have 3 minutes. I stand here in support of the mask mandates because our classroom environments must support healthy learning on the levels of the COVID-19 infection rates. Lake County, 40 schools are not science laboratories. Our over 42,000 students, teachers, support staff, including our transportation staff, are not experimental items. Our students are the precious gifts their parents and guardians entrust us to develop mentally, emotionally, and physically. Here are the facts. Due to COVID-19, too many families have worn the colors of grief, black and white. 6 families throughout Florida have buried their children from the school systems. 51 educators Alachua 2, Marion 7, Bay 1, Dade County 3, Bradford 1, Osceola 1, Brevard 1, Pinellas 1, Broward 3, Polk 6, Collar 1, Santa Rosa 1, Duval 5, Sarasota 1, Hernandez 1, St. John's 2, Hillsborough 2, St. Lucie 1, Indian River 2, Taylor 1, Lee 3, Volusia 2, Manatee 2, Wakulla 1. That was 51 too many teachers, educators. We're asking you to make a decision. Keep our children safe. Keep our teachers safe. Educate our community properly. Thank you.
Now then, we're going to alternate, so I got to do we have anyone on Zoom?
Yes, we do.
Okay, just pick one of them that raised their hand.
I have Taylor.
Okay.
Hello, everyone. Today, I'm pulling up my letter that I wrote. Hi, my name is Taylor Genuardi. I am a mother of a first grader, Beckett. Beckett was diagnosed with dilated cardiomyopathy shortly after birth and received a life-saving heart transplant at the age of 3 months. He is on several medications that suppress his immune system, and for the past 18 months, he has been mostly at home, participating in very few activities due to the pandemic. Beckett is loving attending school in person this year, and I am seeing so much progress academically as well as socially. However, I am so worried with the current mask option policy as well as the local positivity rate. He has a newborn baby sister who's also high risk for serious illness due to COVID. The AAP and CDC both recommend universal masking for students and staff. The Children's Hospital Association just made a statement last week calling on schools to require masking. The statement was signed by the president, CEOs, and executive directors of the major children's hospitals across the country. There are numerous students highlighting the efficacy of masking in schools and minimizing the transmission of COVID, including recent data out of Duke and the ABC Science Collaborative and mask use and ventilation improvements to reduce COVID-19 incidents in elementary schools, Georgia. When schools are prohibited from taking reasonable steps to protect the health of the students, the parents of students with disabilities are forced to make an impossible choice: their child's education or their health. It is Beckett's right to have a safe place to be educated. We are not political, nor do we care what politicians are saying. This is an excellent school that he attends with a STEM focus. Please listen to the science. We are following the advice of public health and infectious disease experts, as well as Beckett's heart transplant team. We are asking you to do the same. Respectfully, Taylor and Joe Genuardi.
Thank you. And we can queue up Chris Haukoos. Chris, Haukoos. Yeah. You'll be, go right ahead.
Thank you, Chairman, members of the board, and my fellow Floridians here. I don't have numbers and statistics and data, but I want to talk about character, because last time we were here on August 23rd, we had faced rain, we had faced blind fury, and furthermore, all who are on the side of our children's future rather than our own witnessed the most vile and most heartbreaking moments that Lake County may have seen in its modern times. Mothers were berated by a small minority of what seemed to be radical fear-mongers with loud speakers. Although this division squad was sent and noise was indeed made through our personal and darkest fears and traits, we had reached common ground. And that is, we both care about our children and their futures. Whether it was in the effort of extra protective procedures or on the basis of liberating freedom for our youth, both echoed on what mattered. Not words from politicians or heroic figures, because we have to be those heroic figures for our children. So, in that case, when did we grow apart from this basic ideology? When was it normal to come to a local school board meeting on such loaded aggression that our children, either here or wherever they find life next, will eventually read on later in life? By allowing ourselves to be seduced by the mirage-like fundamentals of our own fictional plane, we sacrifice the vision of truth and then we become blind. Instead of imposing a single ideology or politicizing an issue as serious as this, why don't we put our weapons of choice aside to gather in the spirit of common ground? That is what I ask the most radical of us all in this time. To me personally, this is what it means to lead our children. To be able to set forth the example that can not only benefit the here and now, but also then and even the distant future. Our children deserve the best in each of us. So let's lead now by stopping the anger towards one another for opinions that are different from each other, because at heart we're all here for the same purpose. When we negatively raise our voices, act ignorant, or speak in vile ways, or act violent towards one another, it sets us back into a painful physical display of demeaning difference for our child to see. They watch us regress into the worst of us, and as noble as we claim we are, this is ultimately what they visualize. I was not able to become a parent myself. Honestly, I had made no chance for that. Regardless, when I see a child hurt from seeing what they witness and what they see in fear, it just breaks me. It destroys my being like a violent bullet riddles through the human body. The worst thing to ever see as a parent is the face of defeat from their child. And we are failing them if we choose to fall apart like this. If our children are learning from us, why are we presently acting selfish by exhibiting unjust discourse that will bring discomfort rather than bring us closer together? Or refusing the truth on the basis of one's actions of leadership that is recognized as inappropriate? Why can't we, in an example of leadership for our children, talk rather than fight on our children's safety and consider a temporary mandate? That is all a majority of us ask for the safety of them. Thank you for your time.
Thank you. And we'll, Rose Fitzpatrick come up to this side, and then we're going to go to Zoom, and then we're coming to you. Look at there. Just one sec.
All right, we have Gabrielle.
Okay.
Hello, can you guys hear me?
Yes.
Hi. I have a baby with me, so I apologize if you hear background noise. My name is Gabrielle Ford. I am a mother of 3 with 1 currently in our schools. And I'm coming to you today to talk to you not about statistics or anything that we don't already know. And I think we can all agree that we can all find statistics that best suit our own arguments, our own personal agenda, and our own beliefs. I think we can all find data research, studies based on what we feel is right. And so I'm coming to you today to not talk about statistics. I'm coming today to talk about our freedom. My husband is a Marine of 8 years and is currently serving in the National Guard. And I bring this up to you because him, among many other Americans, have fought and died for our country to have freedom. And I excuse my shaky voice as this is very important to me, as well as every other parent here and on Zoom and watching live. This country was built on freedom. Freedom to do as we please according to the law that we agree on, that we vote in, and that we, the people, establish. And for some reason, fear is blinding people across the nation. And I ask you to think, if you want to talk about statistics, what are the top killers of our children today? I would say under 3, I think statistics, we can all agree, is drowning. So should we establish a law that requires everyone to fill in their pools until these statistics go down? Should we establish laws that children cannot ride in cars, regardless if they're following the law with car seats, with seatbelts, etc.? No, because number 1, not realistic, and number 2, it null and voids our freedom to choose. And so, although the first few arguments I hear people arguing what is not in question here, what is not in question is mandating anything. If anyone is truly listening to you, as well as what the recommendation is, they would hear that this is not a mandate, this is a recommendation. And my recommendation to you is to think, what is the difference between highly recommending children to wear masks and mandating masks with the parent opt-out option? I mean, if you really want to lay it out, it's basically giving us the same option: mask your child or not mask your child.
Thank you very
my
much.
Question to you,
You're up.
Hi, my name is Chris Hocus, and I'm a parent of 3 children, one of which is a student in Lake County Schools. I come to you today, though, not only as a parent, but as a medical provider. I'm a nurse practitioner, and I'm certified in 2 separate areas: general pediatrics and child and adult psychiatry. This school year, the goal of this board and teachers has been to keep children in the classroom. However, as infection rates rise, we are seeing more and more children quarantined, to the point that one local school had to shut down an entire grade last week. Each student was sent home to learn online instead of being in that classroom. Masks are not a perfect way to decrease transmission, but they are an excellent tool that we have available to us right now. I am asking that the wearing of a mask be added to our policy or our dress code. As a pediatric nurse practitioner, I am able to say without a doubt that wearing masks would help students to remain in their classroom by decreasing infection rates. We as providers wear them to protect you. Over many years, we have seen that masks help to decrease the spread of illness, and not one of us here would have our dentist or surgeon care for us without wearing one. They work, and patients know they work. But here's something else to think about. Having a mask rule would allow special needs students who are not thriving at home to return to the classroom. We, as a county, are not meeting the standards set forth by IDEA when we have essentially set up 2 school systems, one that keeps some ESE students at home, thus not having their IEP guaranteed services available to them because the county has not created a safe environment, and another system that allows other ESE students to come to the classroom and receive their IEP services. The federally protected rights of all Lake County students could be addressed if a mask requirement was added to the dress code, thus allowing all students to return to in-person learning. As a psychiatric nurse practitioner, I can attest that students being quarantined is affecting mental health. The rate of depression cases that I saw following the original lockdown and then the escalation in symptoms after a student is quarantined is alarming. Increased depression has also led to an increase in suicidal actions because students see quarantine as an event that will never end. Teens are at a place developmentally where the events of a single day, a single moment, play out in their minds as if that moment is how their lives will always be. So while we see quarantine as frustrating, they see it as life-altering. Mask wearing can help. It decreases the spread of disease and thus decreases the frequency that students will need to quarantine. We have to keep the mental health aspects of quarantining students in mind when deciding on mask mandates. Masks not only decrease infection rates, but with less need to quarantine, they have the potential for improving mental health for vulnerable students.
Thank you. Okay, we'll call Mrs. Kelly Reed, and then we'll go to Zoom.
All right, I have Tiffany O.
Hello. Good morning. I've tried to stay away from publicly discussing my opinions regarding the current state of the Lake County School Board's handling of the COVID-19 pandemic. I have 2 students who currently attend Lake County schools. I felt it was my responsibility to ensure that I kept them safe by having them stay home for the remainder of the 2019-2020 school year. It was important to do our part to safeguard not only their peers, teachers, faculty, as well as staff, by making the decision to keep them home while further findings were unearthed regarding this pandemic. A year and a half later, I feel there is substantial information now available that people are able to make sound decisions. Based upon the limited options provided for this current school term and the fact that my children were vaccinated, I had allowed them to return to the traditional school setting. School has now been in session for less than 30 days. I have sent my students to school with masks each day. Yesterday, one of my students was sent home to begin his second quarantine. He had just returned back to school on Monday, August 30th, after having received his negative COVID-19 test results on Saturday, August 28th. I want my students to be able to freely get a quality education while staying as safe as possible from COVID-19. Yet with each passing day, it seems less and less as the case. Out of the 17 days of school that have been in session thus far, my student has only been able to receive 9 days of face-to-face learning. When a child doesn't attend school for 15 days during a 90-day period of time, you consider them truant, and the parent and or student could face extensive charges. So who should I hold accountable for my child not being able to receive his education because others failed to wear masks to prevent the transmission of COVID-19?
Thank you. Mrs. Fitzpatrick.
Good morning. I'm Rose Fitzpatrick, and I live in Leesburg. Although I do not have children in school, I do care about my fellow citizens, my country, the planet, as well as my own safety of myself and my friends and family. This is not about personal freedom. The big picture is that we are in a worldwide pandemic, the likes that most of us have never seen, probably none of us. I am at a loss as to why there are some who think herd immunity is the way to go. Whose child or teacher are you willing to sacrifice? I hear my body, my choice, but your choice ends when it affects others. There are many mothers who do not want to sacrifice their children or themselves, and they will do whatever is necessary to protect their family. I think it's a dereliction of duty that there are elected officials who refuse to protect their constituencies, from the governor who is making a big donor of his a lot of money by promoting treatment rather than prevention, as well as an outspoken anti-mask state rep in this county. Instead, they are pandering to the overly blusterous anti-maskers and anti-vaxxers, the QAnon conspiracy believers, and insurrectionists who are actually in the minority.
Please.
A July Gallup poll said 57% of parents want masks. And who knows what it could be now after the spike we are experiencing since school has started. Wearing a mask at this point is the only protection for children under 12. It is time to listen to the real science and the majority. It is temporary, what is asked of you, all of us. Until this deadly virus is mitigated, we are never going to overcome its transmission, and it certainly could mutate to something even more deadly. Everyone's cooperation is needed. Actually, we are obligated and have a vested interest in stopping this pandemic. I dare say it's our patriotic duty not to give a host to this virus. We are playing Russian roulette if we don't. Please be the leaders that you're meant to be for our children.
Thank you. Okay, Mrs. Kiro, you'll be on this side, and we'll go to Zoom.
I have Nicole Ackles.
Hi, my name is Nicole Ackles. I am in Mineola. I am a former teacher, and you don't hear a lot of teachers at these school board meetings, honestly, because we are afraid. I unfortunately quit my job teaching middle school English 2 days before the school year started. It is my passion, it is my soul, it is my everything. And I quit because I can see what's going on in classrooms. What a lot of people don't see is the inequities between students. I have students that parents are refusing masks, and they come into class and they ask for one because they want to wear one to protect other kids and not tell their parents that that's what they want. They see what happens when their classmates are quarantined. They see what happens when their classmates are sick. I'm going to tell you a little story from 2 years ago. 2 years ago, my school was running an active shooter drill, as we often do, and I had a sixth grader, a 11-year-old child look at me and say, well, if my friend gets shot, am I supposed to just leave them? How am I supposed to deal with that if they die and I don't? That is something an 11-year-old has to think about on a daily basis. Now, last year, when we were in person with a mask mandate, I still had students going, what if I'm sick and I don't know? What if I'm sick and I don't have a fever? What if I'm sick and I pass it on to somebody and their grandparent dies or their parent dies? These are things that our kids are thinking about every single day. In the classrooms, it is right now an absolute nightmare, and teachers are not willing to speak out. I've had parents threaten my certification, threaten my license to teach, threaten my job, threaten that they're emailing the school board about me because I talk to the kids about the efficacy of masks. I'm not going to talk about data because people keep talking about data and everybody knows the data. A poll from August 4th of this year showed that 62% of Florida parents want a mask mandate. That is a clear majority. People need to stop saying they researched it. Unless there was a literature review with abstracts, collecting a random sample of sources, taking the articles, looking for biases, looking for implicit biases, confirmation bias, logical fallacies. These are things I teach my middle schoolers, but that their parents seem to be incapable of doing for themselves. Until we can actually take a hard look at science, we are going to keep seeing students being sick. A 30-day mask mandate is the minimum that we can do. I wear my mask to protect others. My mask does not protect me if you choose not to wear it. If people have not learned that after a year and a half, they need to seriously look at their ability to research. Please protect our students and our teachers who are too scared to speak out because of the ramifications of their opinions. Please stop teachers from leaving this profession like I did. I miss my kids every single day, but I could not anymore put my family at risk.
Thank you very much. Mrs. Caro. Oh, wait a minute, I'm sorry, is it you? Wait a minute, stand by, I'm sorry, Mrs. Reed.
Good morning. I am co-founder of Mask Up Lake County Schools. My name is Kelly Reed. I stand here on behalf of 500 families throughout the county. We urge you to issue a mask mandate for the health and safety of our children, staff, and teachers. The AAP, the CDC, the Children's Hospital Association, and more all recommend masking. The medical director of infectious diseases at Arnold Palmer Hospital has said, and I quote, "Cases are skyrocketing." My own pediatrician for my children, Dr. Barry Yarkin, quote, says, there has been a 400% increase in pediatric COVID cases in the past 60 days. 400% increase. An Advent Health pediatric hospitalist, quote, says, children can easily transmit COVID-19. Because of this, we have seen whole families get COVID and subsequently multiple family members die of COVID. We are a community, schools, hospital, businesses. We need to protect each other. We need to help mitigate the spread of COVID-19 to help our overwhelmed hospitals. Doctors and nurses are screaming at us to mask up and help them. Superintendent, your own quote from the doctor recommended masking for all. I know the legal side of this is a concern to you. Mr. Dodd, you in particular have said that you don't get to pick and choose what laws to follow. Yes, you do. We all do. When my oldest was in kindergarten, I received a call from the school nurse that he fell and needed stitches. I raced to the school. Did I speed? Yes, I did. I believe you can all think of a time that you have done the same. This is a matter of public health. There are 43,000 children in Lake County schools. I want the 5 of you to look at the 43,000 babies as yours. What would you do? What means would you go to protect your own children? Now do that for ours by mandating masks for at least the next 90 days. Then implement Superintendent Cornegie's plan. We need help now. We are all COVID tired. Everyone is. But we need to listen to our medical professionals. The medical recommendation is masks. We need a full mask mandate with a medical opt-out only. Thank you.
Thank you. Now we'll call Carissa Ward to this side, and then we'll go to Zoom.
I have Christy Hall.
Hello.
Hello.
Hello. Good morning, board. Thank you for taking the time. I'm a mother of 6, 5 who are in 4 different schools. Last year, my DPK child went to a mask-free school and had no COVID cases. And then he had to go to his speech at the public school and basically had to wear a mask while doing speech. And if any of you guys have speech children, you know that you're supposed to look at their mouth and look at your teacher's mouth to follow what they're doing. And he didn't learn anything. So he had to start kindergarten this year, and he is no better off than he was at the beginning of last year. I have kids at 4 different schools. 2 of them go to a non-mask school, and they have had no issues. And then the 3 that go to the school, the public school, none of them have been quarantined yet. My kids also this year do not come home with headaches. They do not get sent home with headaches. They don't complain when they get home about being all foggy and having a rough day, or that they got yelled at because my one son wears glasses and had to move his mask off his face to be able to see some of his homework. I ask that you please leave this up to the parents and not up to you guys. Thank you.
Thank you. I do want to share, we have a number of cards. We still have folks on Zoom. If you don't need the full 3 minutes, because we're under an hour now for the balance of the presentation, or the balance of the public input. So now, Ms. Guerra.
Good afternoon, Board. I'm here today to request that the Lake County School Board implement a 30-day mandatory mask requirement in Lake County schools with an opt-out in extreme cases only. As you know, Judge Connor decided that in his attempt to direct the school boards across the state, the governor exercised governmental overreach. This is a medical issue and not a political issue. We will not, as a community, stay healthy enough to live through the political circus that is being played out in front of us. And since the school board decision to allow some parents to make the decision of whether to wear a mask or not was based on governmental overreach, I request we revisit the issue of protecting our teachers, staff, and students. I suggest that we follow the CDC and Superintendent Cornegi's suggestions to wear face coverings in public schools for at least 30 days. In Superintendent Cornegi's Super Sunday Weekly second series, she recommends wearing masks and following the CDC guidelines for COVID-19 prevention in K through 12 schools. The CDC update of August 5th reads, given new evidence on the B.1.617.2 Delta variant, CDC has updated the guidance for fully vaccinated people. CDC recommends universal indoor masking for all teachers, staff, students, and visitors to K through 12 schools, regardless of vaccination status. Children should return to full-time, in-person learning in the fall with layered prevention strategies in place. If we respect Superintendent Cornegate, we must follow her recommendations. We cannot expect that parents or children will follow the superintendent's request to mask up when our board members are not masked. In public building, no less. The children and parents will say, do as I say, not as I do. They're right. As a mother, auntie, and grandmother, I don't know how many times I've said, cover your mouth. As adults, it's our responsibility to say it over and over again until children are old enough to form instinct, and because that is what we do to protect them and those around us. In a civil society, we teach them to respect others and to keep our germs to ourselves. The current spike in illness in our schools has a simple solution: cover your mouth. In the pandemic of 1918, masks were the only option. They did not suffer as long as we've been suffering with this. Tell them that the CDC,
Thank you, Ms. Kira. If Mrs. Smith could come forward, we'll now go back to Zoom.
I have Sherry.
Thank you very much for allowing us the opportunity to speak with you today. I am the parent of 4 children who attend Lake County schools, 2 children at Astutula Elementary and 2 at Eastridge Middle School. My nephew also attends Eastridge. I am speaking to you today from a position of concern for the health and safety of our children across the district, as well as our staff. We are all aware of the rampant spread of COVID-19 throughout Florida and Lake County. Sadly, we lag behind the national average on vaccinations, with only 52.6% of eligible people fully vaccinated in this country. I'm dismayed by Governor DeSantis' July executive order effectively banning mask mandates in schools, and by the rippling environment that order has created at each of our schools. The mission statement of the Lake County School District Safety and Security Services is to provide the safest and most secure environment possible for district staff and students of the Lake County Schools District. The department goal is to hold as proactive a stance as possible regarding the mitigation of risk for all persons at all district sites. Superintendent Cornegie stated at the August 30th meeting just this week, the best way to reduce the number of students in quarantine is to reduce the number of students testing positive. We have clear data from our district, which highlights clearly that mask wearing is an effective preventative against the spread of coronavirus. To make that point, I want to remind you of the numbers that we had last spring, the last week of school. We had 7 students test positive and 4 students quarantined. Just the past week of school, in contrast then, we had 439 students test positive and 2,625 quarantined. And this is leaving out the staff who are quarantined, exposed, and testing positive as well. When we compare these, we find that the students who are testing positive this time right now in Lake County schools compared to the last week of school, it's up over 6,000%. This is absolutely unacceptable. When we normalize that data to account for the spread and the increased infection rate for the Delta variant, and we normalize it, we find that COVID infections are up 170% due to no mask mandate compared to when we were requiring masks at school last year. We are now in the position of being able to act on the guidance of experts around the world, as Lane County Judge John Cooper ruled that Governor DeSantis' executive order was unconstitutional and government overreach. As he stated in his ruling, the law is full of examples of rights that are limited when the good of others would be adversely affected by those rights. This is one of those times. We must not allow political divisions to overwhelm the data and to our ability to protect our children. I want to also point out that we have a special duty of care to the minority members of our community. The students of our district are about 30% people of color and 47% of Lake County students.
Okay. Mrs. Ward.
Thank you. Thank you, everybody that's here today, everybody that cares about their kids, whether you're for or against the mask. It's important to be here to speak up. I'm not here to give you a number. I'm here to tell you reality. I have 3 kids in the Lake County school system. Last year, when we were all wearing masks and it was mandatory, none of them were quarantined once. None of them got COVID. None of them were sick for the most part. If they missed school, it was because of other reasons, not because of being sick. As of this year, one of my students is in her 2nd quarantine. She has been back to school for 2 days, and she wears a mask. She is one of, I think she said, 4 in her class, including her teacher, that wears a mask. She says every kid that is getting sick does not wear a mask, and she is the one getting sent home. She is missing vital school time. I get a packet this thick of work that she is supposed to do. I work full-time. When am I supposed to have time to be able to sit down and do this with them if they're supposed to be in school? This is not fair to the students at all. As I'm looking at the numbers that were given to us this morning, what they failed to give us is the number of students quarantined that are missing vital school time. Why can we not just wear a mask to protect everybody and keep everybody safe? That is all I'm asking. It's not, it gets our kids the education that they deserve and that the school board is being held responsible to provide. All I ask is that we do the common courtesy. My 9-year-old said to me, she's like, Mom, I just want to go to school. She's like, this is unreal. If a 9-year-old can understand that this is unreal, that she has to be quarantined because other people won't wear a mask, please. The kids in elementary school don't get to go get a vaccine. They are not eligible for that. They are the ones, and they don't understand social distancing as well as the other older kids. So even if we're in an elementary classroom, they don't necessarily put those protocols. You know, they want to give their kid, their schoolmates a hug, but if they have a mask on, they're protecting each other a little bit more. When my school administrators are online pleading with parents to please mask their kids up, and I respect and appreciate them for doing that and putting themselves out there. Thank you.
Thank you. Okay, thank you. We'll have Gregory Wilhelm to this side, and we're back to Zoom.
I have Rhonda.
Go ahead, Rhonda. You're on mute.
Okay, can you hear me now?
Yep.
Okay, I have a granddaughter who attends Lake County schools, and we kept her out of school all last year, and she did the virtual like so many of the other kids did, and she's back in school this year, and I'm really kind of concerned with a lot of things that are going on. I pick her up in the afternoon. I take her to school in the morning. These children are sitting in groups with no mask. She is sent to school with a mask, and because other kids are not wearing their mask during the day, she isn't either. Well, guess what? We're all quarantined. And we're quarantined because one of her friends had COVID and passed it on to her. And so the only way that we knew that she even had COVID was from the friend, because the symptoms that she showed was a little bit of congestion and a 99.3 fever. Now, my question to everyone is that how many parents actually do the responsible thing and take their child to the doctor with a 99.3 fever? That's probably rare. So how do you know how many people, as for the 5% of masking, how many children actually are symptomatic, like my granddaughter, or not? And, you know, who knows who has this? So why would no one want to wear a mask? It's just uncalled for. And that's pretty much what I have to say.
Okay, thanks so much. Mrs. Smith, and in the meantime, Ken McCard to this side. Go ahead.
Good morning. I'm Kathy Smith, LCEA President. First, we would like to thank everyone for helping to pass a more inclusive reopening MOU. We needed it. We needed the safety. We do have some teachers that are still expressing some leave concerns, and we can address them individually. But it's wonderful to realize that we can and should cooperate to help our students and our teachers. We have worked very hard to provide the district with concerns from everyone, not just members, everyone. Any Lake County employee may visit our revamped website to report a concern. Every day the reports are tracked. They're addressed, whether they're related to COVID or any other worksite concerns. Teachers are going above and beyond. They are asked to do more and more every day. And now with COVID concerns, they're even more stressed. They're stretched to the limit. They're exhausted, as Ms. Cornegie said. Many things could be named, but we'll just say something needs to give, or you're going to lose many more teachers. You've heard from a couple of them that said that they've resigned. There have been 4 teachers who have been hired since the beginning of the year, and they have already resigned. Many teachers developed lessons over the summer, especially with the new curriculum. Now they're being told they have to rework all those lessons and put them in Google Classroom. That takes time. Last year, the people, they had time because we were off for a little while, but they had the extra time they needed. They have no more time left. They're exhausted. To make matters worse, they're asked to substitute during their plan time, or they're voluntold to split their classes and have students added to their overcrowded classrooms already. This is happening way too often. Students should stay with their own cohort, not be combined with another class. It's not safe right now. Teachers cannot meet the 3-foot guideline, let alone a 6-foot guideline. Safeguards need to be in place to ensure the safe and clean environment for our students and teachers. This is about a safe, clean environment. Many teachers do not feel safe, and some have been told that they need to come back even though they don't feel right. They feel sick. Protocols need to be in place and strictly enforced to control the virus. ESSER funds of over $147 million will take care of many safety concerns for this, for our students and our teachers. And the protocols need to be here. Extra assistance to help our teachers and our staff. We need to use some of these funds to help everybody. Thank you for your help.
Thank you. Demco Bryant. And now we'll go to Zoom.
Peter Messer.
Can you hear me now?
Yes, go ahead.
Yeah, I just wanted to say I have 3 students, one with an IEP. We were ones that were caught up in the no school last year for the mask. The year before that, they were stuck to the virtual. Grades dropped as a cause of that. This year, they attended school because there was no mask mandate. Now we're in fear of the mask mandate. Truthfully, my choice shouldn't end where people's fear begins. We've had many soldiers die to give us our freedom. If mask to me equals a problem, then problems shouldn't be in the school. If we're going to wear masks, we should just close the school. That says that there's a clear problem. So masks aren't really effective tool more than they are a destructive tool, mentally and physically. If you got $7.4 billion in funding, what are you doing with it? How far are you planning ahead? Are you looking into the consequences of the child that you deem red? What are you doing to prepare for that? That's a question that I would like an answer to. Hello?
We're not going to respond. Is that your thoughts?
Those are my thoughts. And
Okay, thanks so much. Okay, Mr. McCard.
Good morning. I'm Ken McCard. And I'll leave the science to others, though I have looked at a lot of it, and I would like to say there's an elephant in the room. I thought I was going to say that, but that has already been approached, and that's politics. This is all about politics. The mask, for many of you, is just a way of representing constantly an unpaid ad by the Democratic Party. The next thing I say, I don't mean to be inflammatory. I won't use the exact language that Lenin used, but those who know what he said, when it came to a question, ask him, how are we going to promote the Comintern, which was the Communist Party being extended around the whole world. How are we going to do that with what we're preaching and how the rest of the world feel? Well, he said there are useful, and I'm not going to go into it, but he said there are people out there who will catch on to emotional issues and outside smaller issues that tear down their own societies. And that's what many well-meaning people, which I'm sure all of you are well-meaning people who don't realize that is what you're a part of. You may or may not, I'm not accusing you of, there are people on our side also, I would say the same thing, who just follow the sheep and whatever sounds inflammatory or red meat, and I don't agree with that. But I would say that a lot of us who are wearing masks, or those who are wearing masks, are promoting this idea, really don't know where it's coming from. There are some people controlling the issue. The economy is very important. Education is very important. The herd immunity is something which somebody mentioned earlier. Somebody mentioned 51 teachers dying in the state. I don't think all those teachers stayed at school for 24 hours a day for every period of time we're talking about. They went home, they went to the store and so forth. I don't think there's any proof they got this from their kids at school. So there is information being passed around that we all need.
We don't want comments. We want civility. If you don't agree, I don't expect heckling. We want to be respectful, please.
I heard something this morning, I think it relates to this on the way in. San Francisco's got a group, San Francisco city, that has reduced their police department by $120 million, and a group connected to the city government is sponsoring a program of paying $300 a month to 10 at-risk people who may use gun violence. So put me on the list, all right? But we're going to be paying $300 a month if they don't shoot anybody. What a great idea out of San Francisco. I think it relates to what we're talking about here when it comes
Thank
to...
you.
Thank you.
We'll go back to the next Zoom. Mr. Ralph Smith, you'll come, if you can come to the podium on this side. Okay, Zoom.
I have Veronica Flores.
Hi, hello. Can you hear me?
Yes, ma'am.
Okay, my name is Veronica. I am actually a registered nurse at a hospital in Lake County, and I have a 7-year-old and a 16-month-old. I want to say before school started in the hospital, I noticed the numbers were going up, and I knew, oh gosh, not right before school's going to start. I know they're going to correlate this to school starting, and that's exactly what happened. The first week of school, I actually... I work with COVID patients, and I wear my N95, I wear level 3, I wear a shield, I wear a hairnet and my whole gown and my gloves, and I somehow still contracted COVID at work, and despite all that. So I brought it home to my family. I kept my kids home. This unfortunately happened the first week of school. My child then tested positive. My 16-month-old tested positive. He did not get it at school. He got it from me, and I kept him home. I did my part, and he was asymptomatic. Kids are actually doing fairly well with COVID. I don't know why there is this fear, and there is such thing as natural immunity, which I truly believe in. My kid now has antibodies against COVID, so why would I put him in a mask when masks don't work? Showing all the PPE I wore and I still contracted COVID. I just feel like it should be based on the parent's decision. And I just want to say I completely support what the superintendent's plan was, giving the parent the option based off of how the schools are, because all schools are different, populations are different. And yes, us nurses are tired. We're always tired. We were tired before the pandemic. We're tired during the pandemic. That's not going to change. And COVID is here to stay. The levels are going to be going up and down between the population. And I just know masks aren't the answer. And parents' freedoms are more important. And that's all I have to say.
Thank you, Ms.
Thank
Flores.
you.
Thank you very much. Mr. Bryant.
Chairman Mathias, members of the board, Superintendent Cornegie, members of the public, and my fellow students, good morning. My name is Dencove Bryant, the student body president at Leesburg High School, and the recently appointed chair of the newly formed Superintendent's Student Advisory Committee. After speaking with both the superintendent and other student leaders, not just at Leesburg High, but throughout the county, we all agreed that something must be done because things continuing as they are is simply not an option. It is because of that I, on behalf of the students, am supporting the superintendent's recommendation to implement a mask mandate with a parental opt-out. for schools with a positivity rate over 5%. This is the best way forward for all of the stakeholders in Lake County, and this is the best and most creative solution to an issue that has no easy solution. I applaud the superintendent and her team for their hard work in putting this together. I'm happy to live in a county where the superintendent, despite all the negativity being thrown at her, every single day puts the students first. Members of the public, regardless of what side of this issue you may fall on, I encourage you to look at this from an objective point of view, because there is something that everyone can take away from this agreement. And to quote former Speaker of the Florida House, Jose Oliva, let our debate lean on the strength of our argument, not the volume of our voice. Amen. I challenge each and every one of you to rest your argument on its strength, not how loud you can yell into a microphone. I challenge you to honor and respect each other and remember that we're neighbors, not adversaries. Remember that each person in this room, regardless of where their stance is here because they care about students. And most importantly, I encourage you to remember what Jesus said in John 15, verse 17. This is my command, love each other. A mandate with a parental option to opt out is the best way forward for Lake County. God bless Lake County and every single person that calls this place home. Thank you.
Thank you very much. Okay. Molly Phillips, come to the mic, and then we're going to Zoom.
Of Elizabeth Wilcox.
Mrs. Wilcox. Okay, we don't have that Zoom, so we'll go to Mr. Smith.
Okay, first of all, I want to thank you, Mr. Mathias, for having me follow Mr. Bryant, who's the most articulate person I've heard so far today. And whatever they're doing at Leesburg High School, y'all keep doing it and get the other schools to replicate it. Thank you. The only thing I will add, because there's not much to add after what he said, he kind of I think he stole my notes. Seriously, is two things. Number one, if you do decide to go with the super, and I listened to it as I was driving here. I got here late, and I heard her on my phone. And I thought it sounded very reasonable and very sensible and very common sense. There are a lot of people in here that are very shrill and emotional, and I get it. My wife's one of those people at times, not in this issue. But, you know, if you've been married 46 years, you know what I'm talking about, right? But nevertheless, honey, I think she's watching me. I shouldn't have said that. But anyway, with that said, I think that's a very reasonable thing. And also, though, the only qualifier I would add, if I may, I heard a report last night that cloth masks for kids are having no effect one way or the other. Surgical masks do. So if it's possible, I don't know the expense, the cost, or how you do that, but I would think if it's like 11%, they say. So if it's going to have any effect, it's not just going to be a feel-good thing. I would request you look at that and consider a surgical mask or do your own research to make sure whatever you're doing is at least somewhat effective, even if only minutely. But I think I trust your superintendent. I trust the majority of the school board. You guys are good people, and I would not have your job for nothing.
Thank you, Mr. Smith. Okay. Sharon Bouchard. And in the meantime, we're going to Zoom.
I have Wakina McMillan.
Yes, can you hear me?
Yes, ma'am.
Thank you. I'm a mother of three of four of the four who are students in the Lake County School District. As of yesterday, myself, my 9-year-old, 5-year-old, and 1-year-old all tested positive for COVID and are awaiting results for my 4-year-old. Again, they are 9, 5, and 1. First, let me say that we are pro-mask because we have witnessed the effects this virus can have on individuals, as we have lost more than a few family members to this virus, 2 passing away just last month. For us to now be experiencing it ourselves, I cannot express enough how miserable and debilitating the symptoms that we are feeling as the whole are.
Additionally, I cannot express how afraid, infuriated, and guilty I feel as a mother to have allowed my children to attend a school who seems to have had no concern about the health and well-being of my children. And as a result, we are all suffering. We are not only just still grieving for our family members who have succumbed to this virus, but we are now doing our best to heal while praying that we overcome this virus. If numbers are increasing, masks need to be mandated. What we are going through is unacceptable. It is time to either mask up or close schools down. Thank you.
Thank you. Mrs. Phillips.
Hi, my name is Molly Phillips. I'm a former UCLA Medical Center ICU nurse. I'm not a public speaker whatsoever, so bear with me. Current stay-at-home mom of 3 Lake County children. Peer-reviewed studies have shown there is no benefit to masking kids. We are causing more harm by masking without any proof of benefit. COVID-19 is here to stay, and ongoing restrictions have the potential to cause even more harm. Regional analysis in the United States does not show that mandates had any effect on case rates. According to CDC data, 85% of people who contracted COVID-19 reported wearing a mask. The Journal of American Medical Association confirmed that masking children wasn't just unnecessary, it was legitimately dangerous. Coronavirus will continue to be infectious. The virus will continue to spread largely by people without symptoms. We can't halt human existence to stop the virus entirely, nor do we need to. Risk is everywhere. Car crashes kill over 1,000 American children under the age of 15 every year. That is about 3 times the amount of children who have died with COVID in the past 18 months. We've accepted this risk and don't revisit it with every news story about a car crash. Also, statistics from the swine flu in 2009-2010 show 3 times as many children died than in all of this COVID crisis. There are several consequences of masking children. The discomfort of a mask distracts a lot of the children from learning. It can cause acne and other skin problems. Masks are definitely vectors for pathogens, and if they become moist or are used for too long. It could lead to long-term dental problems. Actually, 5 times more children have died from suicide than COVID since COVID started, with a 51% increase in suicides since this has begun. Another big issue is bullying. If we go to there being an opt-out, I'm really afraid of the bullying of the children whose parents have opted out. Last year, my daughter experienced this over and over. She has asthma, and she also is very afraid of being in enclosed spaces. She would pull her mask down just so that her nose would be out, and the kids would scream at her about it and put your mask on, and she'd say, I can't breathe.
Thank you. Thank you very much. We'll have Brent Phillips on deck, and we go back to Zoom.
I have Sean Marshall.
Mr. Marshall.
Good morning, everybody. Thank you very much for allowing me to speak here. And thank you, everybody, for coming out to participate and help everybody here understand what we need to do as a community. I am a father of 2 daughters in Lake County system, and I want to make sure that them, their friends, their teachers, and everyone else within their families are safe. Masks help. We've known this for over 100 years when we had to deal with the Spanish flu. And if we go back in history and read up on the Spanish flu, we will see that we had the same type of debate on whether to wear masks at all and if they help. Masks do help, along with other measures. And we need to take these measures without stymieing each other, without trying to feel like we are coming about and putting these mandates in a way that will suppress each other. The masks do not suppress anything but any virus that comes from your lungs and goes out into the air. That's it.
Okay, thanks so
Anyone
much.
who wears a mask indoors is showing that they care about what you want to do in protecting other people. Anyone else who says otherwise really hasn't looked at what the science says and what history has said. So what we really need to do here is just to sit down and actually look at each other and say, do I want to protect the person that I'm seeing? Do I want to protect the person that I'm encountering in an enclosed environment? The masks do help. And for anyone who says, well, we need to be able to see some of the nonverbal communications or be able to have our students see the teachers' faces whenever they're communicating with them, let's get the teachers' face shields. So that way our students can see them and see their faces and see their lips and see how they react to everyone else. Other than that, really, there's no argument here other than we want to protect each other. And we want to make sure that we don't keep continually spreading coronavirus around our communities. We've seen this happen before in the past. Look at the Spanish flu. There were 3 major spikes because people did not want to take the precautions necessary to suppress the virus. Let's not repeat history again. Let's take whatever measures that we can to ensure that we all stay safe and we can get rid of coronavirus. Thank you.
Thank you very much. Mrs. Bouchard.
Good morning. My name is Sharon Bouchard. I've had many titles in my life. In the 1960s, I became a daughter. In the early 80s, I owned and taught at a preschool in Umatilla. In the late 80s, I was a paramedic in Lake and Orange County. In the mid-90s and for 16 years, I was an account executive for one of the largest health insurance carriers. And in the late 90s and 2000s, I became a mom to 3 children. I'd like to speak today from the perspective of a daughter, a mom, and a former paramedic. My grandparents, as well as my father, used to always carry and use one of these, a handkerchief. My father's primary care physician, cardiologist, nephrologist, and infectious disease doctors all urged him to discontinue using the handkerchief, that it was a breeding ground for germs. I see very little distinction between the use of this handkerchief and this mask. In my role as a mom, I took my 3 children to a very well-respected pediatrician in Orlando. I followed his recommendations on breastfeeding, proper car seat installation, vaccinations, infant swim research, and more. When my kids reached their preteen years, he recommended the Gardasil vaccine. I did my due diligence as a parent. I reached out to my broad network of health and wellness clinicians. I spoke to my colleagues, including pharmacists in the health insurance sector, and I made an educated, informed decision as their mom to refuse that vaccine for them, my choice as their parent. I would have been very disheartened if, as a parent, my voice and my choice would have been superseded by a mandate to do something that I believed was not in my children's best interest. I believe the same parental rights and parental choice should apply as to whether a child should wear a mask. It should not be a forced mandate, but instead an informed parental decision. And although I agree with a portion of board member Christy Burns' quote that something is wrong in Lake County, our opinions far differ after that. She stated in the August 9th board meeting that a huge majority of parents don't actually care about their kids. I think nothing could be further from the truth. From my vantage point, I see parents on each side of the mask debate who are passionate about the well-being and safety of all children in the Lake County school system. Although I never attended medical school and became a doctor, I do have a strong knowledge base of medicine, based on the years I spent diagnosing and treating thousands of people in Lake and Orange County as a paramedic, people who were often in life or death situations. And my medical knowledge continued as a medical underwriter and then an account executive for United Healthcare, where I was educated on an evidence-based approach that is data-driven. I urge you to do and vote with our children's best interest in mind.
Thank you very much.
Parents' rights.
Okay. Mrs. Danny Page, we'll be queuing you up over here. And we go to Zoom.
And for the record, that was false. That is taken out of context and not truthful at all.
Wait a minute. Dr. Burns, please.
She called me out directly, and every other time any other member has ever been called out, we have always allowed you, Bill, to speak to it. She directly misquoted me and took it out of she took it out of context.
Please.
Thank you.
Okay. Okay, everyone, please, order. Okay, we're going to Zoom.
Have Carl Kylier.
Hi.
Oh, wait.
Can you hear me okay?
And in the meantime, Vance, oh no, we got Danny Page. We're good.
Can you hear me?
Yes, we can hear you. Go ahead, please.
Okay. All right. I'm a retired respiratory therapist, about 40 years of working in several counties, Central Florida. Was educated because I served in the Navy at the end of the Vietnam War and got the GI Bill. My brother was a corpsman for a long time, worked his way up to be a PA. Something I'm going to do my brother didn't do. I'm about to turn 68. He died of cancer. I'm a cancer patient now, but when I first retired from respiratory, within less than a year, COVID came out. Governor DeSantis sent me a letter saying that even though my license expired, I could get a 90-day thing to go back to work because they needed respiratory therapists. I'm also the husband of a Lake County school teacher, but I wear a mask a lot, mainly when exposed to diseases like tuberculosis, every type of flu bug. And luckily for me, I never got sick. I do hear some people, other medical professionals, talk about things where masks are dysfunctional this way or that way. And it's a different kind of mask for different occasion, and worn properly, they do what they're supposed to do. But I also know that my wife, as a school teacher in Lake County, is concerned more about me than she is about anything, because our two children have grown. They're close to 30 now. They all went through their schools here in Lake County. But she might bring home from her job something. I managed to live 40 years without getting sick. But my immune system been whacked down. I'm lucky my cancer was detected early and pretty much all but gone. But people I'm more concerned about than myself or even my wife, September is National Pediatric Cancer Month. 47 children every day are diagnosed with cancer in Florida. These are statistics from St. Jude's, a wonderful hospital in Tennessee to treat children with cancer. And then there's a lot of children who might have cancer that haven't been diagnosed, but their immune system of anybody that's in an underlying condition that's yet undiagnosed, I really believe masks can help a lot. I'm not sure they do everything, and there's people trying. I'm sure there's people who have gotten colds, but I know in the hospital wards that I've been as a patient and as a therapist, especially in Shannon, there were children with leukemia. They wore masks all the time to protect themselves. And it is really good that people are listening with their two ears and not talking so much in the volume and the visceral that have been some other meetings. But I'm really happy that I am well enough to say that I know masks protect me in my 40 years as a respiratory therapist. Probably done 1,000 intubations.
Thank you very much.
Thank you.
Mr. Phillips. And Lori Baxley, you'll be after.
Good morning, Chairman Mathias, board members, superintendent, and counselor. 246 years ago, Patrick Henry uttered the words, "Give me liberty or give me death." I hope we're still teaching our children what those words meant and why they were said, and how important they were to the founding of our country. I'm afraid just 246 years later, we're a little bit more like, take my freedom, I might be getting a cold. And that is scaring me for what the future of our country looks like. Benjamin Franklin also said, when asked what kind of government we ended up with after the Constitutional Convention, and he said, a republic if you can keep it. The challenge of a republic is to protect the people from the dangers of mob rule. And mob rule can occur when an outspoken and unruly group overwhelm the will of the people and manipulate boards and government agencies to take on actions and activities that don't reflect what the values of the community truly are. I think at one point in time, it would have been very difficult to get a group of people to agree to be taxed. But it was something that had to happen, and leaders like you were in difficult positions to make those calls on behalf of the people and what was the right thing to do. I'm a little disappointed, quite frankly, and I didn't think I was going to go this long, but I'm a little disappointed. I think the superintendent's presentation was wonderful, but it's not lost on me that the more poignant details were missing from the slide presentation. I'm still a little lost on exactly how the plan will be implemented, and I'm a firm believer, and this isn't accusing anybody of anything, but there's an old adage that liars figure and figures lie. It's a little confusing to me how the thresholds were established, and I appreciate Dr. Burns for pointing that out. 4.5%, 7.2%, what number is going to make the difference? I think there's a lot of vagueness in what the plan is. I understand you got to kind of draw a line in the sand. I'm just not sure there's any science behind why 5% would be the magic threshold. The last thing, I think that we've all been victimized by a global pandemic and terror campaign, quite frankly. Masks are the unhelpful and unhealthy weapon that perpetuates that terror. I respectfully request that you deny the recommendation put forth by our superintendent. Two last points I want to. I think it would be very unfortunate if we did a board authorization for a law that might happen. We might as well start guessing on what laws might happen in 2050. That's a very dangerous precedent to set. And then I also would like to echo my lovely wife who paved the path before me. My daughter, she's kind of a meek and a special child. She was bullied last year. She was accused of being a Trump supporter, one of those nasty Trump supporters, because she tried to be able to breathe.
Thank you, Mr.
Because she was
Phillips.
forced to wear a mask that doesn't do any good. Thank you.
Now we go to Rebecca Mora on Zoom. Zoom. Going once. Going twice. Mrs. Page.
Yes, it might surprise you today that I didn't come here armed with a bunch of medical research, because I and many others have already indulged you with those. So one would like to think that receiving such information like that would open your eyes to the fact that masks, surgical or cloth, don't mitigate the spread of COVID. Even Ray Charles could see that, but not someone like you, Christy. No, you and others like you, Christy, want to take the rights away
not
from
personal,
parents
please.
to decide what's best for their children while in public school, which, by the way, you must loathe because you don't even send your kids to public school, but that's another discussion. Where do we draw the line? Where do we draw the line?
Please.
Stop spitting and punching people. Thank you. Masking kids, where do we draw the line? Do we mask them when they have a cold, when they're suicidal? How about when they have a cold sore? Where do we draw the line? Case in point. And I know you said to make it personal, but she wants it. So, Christy, you look like you haven't missed a meal in a while. How about we mandate you?
Mrs. Page. Mrs. Page. Mrs. Page. Mrs. Page. We will be civil, and you will not attack a board member.
You called me a fraud before.
Please. Please.
Okay, so how about we mandate you and others like you to maybe stop eating double quarter pounders with cheese or pizza? Listen to
Mrs. Page, we're done. Mrs. Page, we are done.
No, we're not.
Yes, we are.
I get 3 minutes.
No, ma'am.
Because that makes you
I am invoking the civility clause. You are to end.
invoking my constitutional right of, I
Okay.
have 3 minutes.
Mrs.
I've already called I have 3 minutes. I have 3 minutes. If you would look at the
Mrs. Page, if you can be civil, then we'll finish.
I'm just trying to point out, there's an article up there that I handed you all specifically, Percy, so she could see what I'm talking about. That people, the CDC just came out with that people that are obese or overweight, it destroys their immune system, hence making them more susceptible contracting and spreading COVID, which, like I said, right there's an article right in front of you. 78% of people hospitalized for COVID were overweight or obese. So how about people that are not overweight? To make us feel better, we mandate that you stop eating like that and you get a gym membership. Do you see how stupid this sounds? Where do we draw the line? Do you want us to control the way you eat? What you put in your body? Because
Do not address Mrs. Burns personally.
Okay. Well, this mandate would control what we put on our children. So should we control what you all put in your bodies? I mean, it makes no sense. And
Please,
don't forget, we shouldn't eat peanut butter ever again because you could literally kill someone with a peanut butter allergy or peanut allergy just from breathing on them, right? But then, we might need masks again. So by the way, does anyone here know how many times Miss Burns and Miss Cunningham removed their mask at the workshop on Tuesday? Anybody? Well, that would be 16 times for Christy, and that is on video. She removed her mask, and 9 times for Miss Cunningham, and that was just for a 3-hour meeting. Yet you want to muzzle other people's children for 6 to 7 hours every day and on a hot bus ride home? Judging from the 16 times you removed your mask, I don't think you'd make it through a school day, so don't expect our children to. And I'm just going to wrap it up with a little meme I saw on Facebook the other day. Some people feel the personal choices of others are selfish and need to be regulated, but what's really selfish is expecting others to surrender their liberties so you can enjoy a false sense of security.
Thank you. I have asked for civility. If you dissent, I will ask you to leave. This is the last time I'm going to address this.
My apologies.
Okay, thank you. Okay, Jennifer Yagoric. Jennifer Yagoric. But in the meantime, we're going Zoom real quick.
I have Amanda.
Hi, everybody. My name is Amanda. I've worked in the medical field my entire adult life, both in the military and civilian sectors. I actually work in radiology, so I do see all of these people who come through with COVID, and I'm actually the one who takes pictures of their lungs. I don't want to talk about statistics because we've all thrown those numbers around over and over and over again. But the fact of the matter is, these are our children, and our children follow by the example they're set from at home. And if we have parents who are anti-mask and they're putting that stuff out to their kids, they're going to feel the same way. And this is not about wanting to control anybody and take away people's freedoms. You know, as somebody who served in the military, my husband's a veteran as well, we support mask mandates because unfortunately, people don't know how to do the right thing. And that's why laws have been put in place to protect our children in car seats and from drowning. As you know, Florida does have laws regarding what can and cannot take place when you install a pool in your home. We have to protect these children. And even if masks aren't extremely 100% effective, we know they're not. But these kids 12 and under, this is the only method of protection they have. 2 children died in Jacksonville yesterday. Who's to say that the next child is not your child? And people throw around, well, what illnesses did the child have? What comorbidities do they have? It sounds a lot like, what was she wearing? And quite frankly, it's awful. And I understand that there are parents who don't agree with masks, and that's fine. But we have to take the steps that we can to protect these children. If your child has an educational situation where they need to see their teacher's face, I have commented on the Lake County School Board. I will personally, out of my own money, donate the Clearview masks to both the teacher and the student. So please reach out to me because I will help you. But we have to take care of these kids. We have no other choices but to mask up. And I'm not going to take my whole 3 minutes because there's other people who need to speak. But I have seen children die from dry drownings and all these other things that could have been prevented. And parents chose not to follow the rules. I've seen, our last meeting, there was a person who said parents know best for their children. Well, you can tell that to the kids that I've had to x-ray their entire bodies because their parents beat them and broke their bones. Parents do not always know best. And it's an unfortunate situation, but we have to do what's best for our kids. Thank you.
Thank you. Okay, so we're down to the 4-minute mark. So with each person with 3 minutes, we're going to go to the two that are at the podium, and we are done with the Zoom. So, Mrs. Baxley.
I would like to share with you something very important information that should be considered before this vote is cast. We know DeSantis signed into law the Parents' Bill of Rights, specifically Part C, the right to make health care decisions for his or her minor child. But I would like to bring to your attention the 14th Amendment of the United States, specifically the Due Process Clause and the U.S. Supreme Court precedent that solidifies parental rights. In Prince versus Massachusetts, the court confirmed that there are constitutional dimension to the right of parents to direct the upbringing of their children. It stated it is cardinal with us that the custody, care, and nurture of a child resides first in the parent, whose primary function and freedom include preparation for obligations that the state neither supply nor hinder. Pierce versus Society of Sisters, the court states, the child is not a mere creature of the state. Those who nurture him and direct his destiny have the right, coupled with the high duty, to recognize and prepare him for additional obligations. In Troxell versus Granville, the Supreme Court states the interest of parents in the care, custody, and control of their children is perhaps the oldest of fundamental liberty recognized by this court. In light of this extensive precedent, it cannot now be doubted that the Due Process Clause of the 14th Amendment protects the fundamental right of parents to make decisions concerning the care, custody, and control of their children. The court states that the Due Process Clause guarantees more than fair process. The clause includes a substantive component that provides heightened protection against government interference. Clearly, this body does not have the authority to infringe on parental rights. And I would like to point out that as of this time, the circuit court order has not been released. There is no official documentation. This body should not make any decisions until that case is settled in a way that has jurisdiction over Lake County, because Leon County District 1 does not have a jurisdiction that binds Lake County. Most importantly, a blanket mandate over any school or schools that does not allow a parental opt-out is not narrowly tailored, nor does it achieve a compelling state interest when the survival rate of children in Florida with COVID is 99.995%. Thank you.
Mrs. Ugoric.
Much. I'm Jennifer Ugoric, and unlike many who have spoken in support of a mask mandate and that are not, many are not parents of children currently enrolled, I am a parent of 2 children currently enrolled in Lake County schools, and I have an actual stake in this decision that's made by the board. I shared in the last school board meeting that I was a school-based nurse in this county for 7 years. Aside from working in settings where I've needed to wear an N95 mask, not a cloth nor a paper basic medical grade mask, as we're pushing today, to protect myself from things like active tuberculosis. I have a pretty extensive knowledge of actual science as it applies to the efficacy of masks. We've heard all of these things, but you get to choose what you believe, just as we get to choose what we believe. But the county attorney has pointed out there's no written order at this time. All right, we've already covered all of that. I love that Linda Caro pointed out that this is a medical issue. I agree. So since we can agree this is a health issue, a medical issue, the law as it applies to parental rights must be followed. So not just Florida law, but I believe we have federal laws that give me parental rights as well. Since one board member who shows unprofessional outbursts feels that she knows what's better for the rights and the health of our children than their own parents do, I've offered actually to go, and I'll extend it to the board, to your doctor's appointments, and I'll make your decisions for you, because I don't think anybody wants that.
because I don't want you making money. So requiring of us as parents to mask our children against what we believe to be right is just as ludicrous as me going to your doctor's appointments. My daughter, who is now a freshman in a college, last year as a high school senior, was forced to wear a mask. She is an athlete who has never had any prior mental health issues. She had severe anxiety, 4 panic attacks during the school year. A high school senior. Give me a break. A girl who's played travel ball, who is at a very high stress level for a student, okay? Played every sport in middle school. But the mask made her feel claustrophobic. She was forced to wear it. She had a decline in her grades. She was diagnosed with anxiety and depression and prescribed medication. Since graduation, amazingly, the summer came. She no longer needed the medication. She no longer had those feelings. She doesn't take that medication and is actively on a college campus where masks are not mandated, vaccines are not required, and she's thriving. No more of those feelings. Last year, my 8th grader, who has severe allergies, forced to mask and was afraid to stand out. He had a teacher who was extremely pro-mask, and he didn't want to face the wrath of his teacher. Was that all of his teachers? No. Last year, he had inflammatory passages, severe nosebleeds, headaches. Please, don't choose for our kids.
Thank you. Okay. So that ends our 1 hour and 30 minutes. I'm going to read the names of those of you in the room, and I also want to commend everyone in here for the civility towards each other. It's really well done. And also, whoever that is that announces the Zoom guys, is that like the best voice ever? Anyway, so I'm going to start. Mrs. Luke, we have some emails, people that emailed in. It'll be name and position. I'm sorry, we're out of time. I'm sorry. Alicia Masterson is in opposition. Vance Yoakum is in opposition. Sandra Brumley is in opposition. Carissa Haslip is in opposition. Teresa McGrath in support. Marianne Wolda, okay, is in support. Jackie Grossnell is opposed. Jonathan Harris is opposed. Sasha, oh man, this is why Stephanie Luke does this. Asdounian, huh?
You did a good job. You read it in the record.
Okay, it's in the record, and she's opposed. Amanda Destal, thank you, is in opposition. Mary Peshman is in opposition. Kate Capola is in support. Tom Vale is in opposition. Lynette Gee is in opposition. Julia Grimes is in opposition. Katie Swanson is in opposition. Cheryl Churches is in opposition. Elizabeth Emery wants more information. Amber Scofferum is in opposition. Alexis Rodriguez is in opposition. And so that's everyone that's here right now that had signed up to speak. So now then I'm going to let Mrs. Luke read those that signed up but waived their right to speak and their position.
So the people who waived their right to speak that were in opposition to masks are Madison Butterfield, Jennifer Anthony, Diane Vinetta, Amy Forteberry, Shayna Grunewald, Carrie Castor, Rochelle Miller, and Elizabeth Slater. And those who waived their right to speak but are in support of masks are Mandy Richardson, Tony Richardson, Megan Oakley, Lauren McGinnis, Bill Oakley, Jacqueline Sorzano, Nancy Linville, John Arkey, Lisa O'Brien, Kathleen Weaver, somebody from Eustis, Ann Osborne, Ellen O'Neill, Terry Keplin, someone from Claremont, Tammy Lewis, Zachary Snademan, Ornetta Slaughter, Patricia Jackson, Michael Brissett, Dr. Edward Lalonde, Marianne Wolda, Kim Norenberg, Lewis Carter, and Gregory Wilhelm. And if you'll bear with me, we received a significant amount of email that was public input that was submitted via email as well. And I've been asked to read these names in the record in support of or in opposition to masks as well. So
Those of you that don't know, Mrs. Luke, when she gets going, she can talk really fast. So,
I don't have my glasses on then. This is smaller, so bear with me. Okay. I have Elaine. These are masks being optional or parent choice. So the way that I interpreted these are the folks that are not in support of mandating masks. This would be Elena Gruss, Katie Swanson, Amy DeSantis, Hunter Longest, Tiffany Longest, L. Owens, Sam Fiorito, Nicole Fiorito, that's not right, Carrie Wanberg, a concerned parent, John Wanberg, Brett Eddy, Karen Smith, Jennifer Stack, Melissa Packwood, Jonathan Harris, Stacy Shepard, Richard Riker, Heather Langford, Whitney Dort, Heather Gringasso, John Langford. This isn't as fast as you just proclaimed me to be, Mr. Mathias. Jelania Kramer, Mrs. Bryant, Jimmy Jackson, Dana Kramet. No, that's Kramer, sorry. Kramer. Donna Carson. Someone that's unknown, it's just an email address. Sunny Isaac, Kaylin Handy, Danielle Quick. This is a long email. Chris and Kaylee Smith, Melissa Ott, Naomi Cheatham, Tony Gibson, Kevin Napier, Tara, Kevin Napier again, Summer Zimmerman, Janet Ashbaugh, Jamie Hensman, Morgan Ryan, and I, Jody Sevier, Jimmy Jackson, Lance Fisher, Brian Bruce, William Phelps, Chelsea Foley, Sarah Van Vorst, almost done with this stack, Ashley Lauk, Megan Smith, Angel Pagan, Chase Rich, Amy Gant, Sarah Keeling, Bonnie Rich, Jamie Hensman, Lindsay Washburn, Michelle Fowlks, Natasha Keller, Amber Snow, Whitney Dort, and Lori Dunn. And then the following emails were those that are in support of a mask mandate, and these were emails, so there's various recommendations of mask mandates, but it was in favor of mask mandates. So I have Michelle Vivieros, Brittany Johnson, Bob Ramstad, Richard Day, Jason Wilson, Catherine Garcia, Stephanie Rivera, Brenda Worsham, Sarah Walker, Juan Quitos, Melissa Crittenden, Crystal Gamino, and someone who did not put a name, Megan Doe, Morgan Simon, Amy Haddad, Jessica Katz, Ashley Ortiz, Caitlin Soroka, Jessica Findley, Ale Christopher, Howard Howell, Eileen Carlsberg, Tausha Cochran, Teresa Massaro, Andrea Wunderlich, Alicia Wilson, Trista Edgley, Carissa Padane, Mallory Rosenberg, Ben Edgley, Mandy Richardson, Danielle Parzuchowski, Christina Weaver, Kaylee LaFollette, Wendy Estrada, Rachel Danuelt, Anna Massaro, Stacy Shale, Mia Gilbert, Kelly Johnson, James Cote, Samantha Long, Kim Norberg, an unknown, unsigned, Lucy Rathier, Patty Winston, Karen West, Eileen Rand, Marguerite Long, Lisa Campbell, Melanie Howell, Linda Grad, Joyce Massaro, Daniel Wettenmuller, Nicole Couch, Eileen Fleming, Cindy Yale Duane, Aaron Crane, a no-name email, Michael Lombardi, Tori Kelly, PhD, Barry Morlachta, M. Quitos, Frank Wood, Ruth Douglas, Elizabeth Fearson, A. Quitos, Elizabeth Holloway, Krista Lynn, Barbara Hill, Elizabeth Melendez, Karen Pearson, Kimberly Costa, Patrick Costa, Pat Costa, Joanna Bailey, E.C. Griffin Forkley, Deborah Costa, Tracy Harper, Stephanie Fleming, Christina Slimy, Tammy Collinger Morales, Marcia Russell, William Ham, Mary Aspidon, Jean Sanchez, Amanda Acavede, I didn't say that right, Joanna Bailey, Khalida Prabhu, Brady Walter, Thomas Morgan, Kelly LaFollette, I think I've said that name already, Norma Kessler, Whitney Dort, we're almost done, Stacy Witten, Eileen Prendeville, Janine Boylan, Lauren Voeller, Maribel Rodriguez, Amanda Prihoda, Bobby Wavrin, Jennifer Caldwell, Jana Esden, Maria Maldonado, Ellen Green, Sam Green, Kathy Buettenmuller, Madeline Almedo, Amy Gates, Cheryl Smith, Ian Palmer, Anna Juarez, Stacy Duppenthaler, Michael Shale, Jacqueline Urquelo Sorozano, Jessica Carr, Katrina Miller, Lindsay Russell, Jillian Rivera, Nicole Hayek, Deborah Lord, Veronica Butts, Kyla Moore, Dana Carroll, Thomas Smith, Andrea Hodgins, Alicia Gomez, Carly, Zachary Snademan, Linda Kiro, Amanda Daniels, Nancy Pierce, Jason Williams, Melissa Ward, Kelly Whitley, Marcella Rodriguez, Kevin Edgley, Brianna Davis. And then I had a couple of emails that were non-specified in support or not in support of. We had people asking for better guidelines with the staff to look at the decision tree in regards to quarantine, asking for a Lake Live option. Again, there was 2 of those. This one is concerning the decision tree again after exposure, so maybe some clarification in regards to that. This was in regards to quarantine as well, and just how do we making those decisions, and then quarantine policies. So there was 3 emails about
Thank you.
quarantine.
And there were 2 late that came in, Jessica Crepone in support and Terry Watkins in support. So that concludes all the public input, and we've done our homework. We have 10 minutes to 12. I understand there's a reason we have to close, we have to shut down at 12, is that right?
I thought we had till 2.
No, we have to take a break at 12? Is that accurate? Y'all have to reset something at 12? Okay. You were talking really good before, but I am not hearing anything right now.
12:30 to 1.
From 12:30 to 1. Okay, well, we can be done with this by
We'll
then.
need to take a 5-minute break around 12:30 or 1 o'clock.
Oh, 12:30. Okay, we're in good shape. Okay, so now we're able to take up the superintendent's recommendation, 3.01. So board members, this is now open for any other additional comments.
Well, I guess I kind of go back to looking at our meeting earlier in the week when we designated that this would be a kind of a fact-finding experience, and that I was kind of hoping to also hear from members of the health department. Were any of them available to come today?
They were not. That's why they sent the data. They sent me those specific slides and asked me to share them with you.
I guess with that, I'm just not sure how we can take action on that. I think, as constituents have approached me, I've just echoed the thoughts of Monday's workshop where we talked about this being a fact finding, that there would be no action taken. So I don't feel comfortable taking action today with that information.
Okay. Board members? Any other comments?
The only comment I'm going to make is I think that the thing that we're trying to avoid, and I'm just going to say it as transparent as it's probably not going to come across, is that we're trying to avoid, we are getting, and by all means it's because of the passionate nature of this, but we have listened to public input for an hour and a half already, an additional hour and a half, and I'm sure when we come back to meet again that the same group, like you guys want to make sure we're hearing your voices. And so then if we're going to do this again, we're going to do it again and we're going to make a decision. Like, I want it to be public knowledge. We're going to do it again. The decision's going to be made, and we're not going to do this again after this. I don't want to keep doing this. No. I don't.
I share your same concern, and I think that we had squeezed in to try to get this particular room, and because of that, we had to hold the meeting at the time that we've held it, and I know that there was some backlash of, is the school board trying to hide by not doing it in the evening? No, it was just a matter of the timing of this room, and the idea was that we were going to try to have folks from the health department here, because and
Mark, they're not going to come.
Well,
they're refusing. They're refusing to come. We've been trying to get them to come for 2 years.
So I guess I think the trouble is that that we have very eloquent speakers on both sides of this issue, and they all present statistics and facts, and I want to reconcile those against what the health department folks say about various.
They won't.
Well,
they literally won't. We've been trying for 2 years, or 18 months since this began.
All right, but the other piece of that is that I think we left the Monday's workshop with the impression this was going to be fact-finding. We were not going to make any decisions, and so that's just been the message that I think folks have heard. Did you all walk away with the same impression that I did?
Mr. Chairman.
Yes, ma'am.
May I speak? First of all, I would hope that everyone out there, regardless to which side you happen to be on this, that you know that we're really truly trying to do our due diligence. I speak first and foremost for myself, and I hear the parents who don't want government to tell them what to do. I hear the people who have real concerns about children being unmasked, and that group of students who are at an age where they can't be masked. I feel both those things personally. I'm a grandmother. I have 2 grandchildren that are in that area. But I think first, everyone needs to realize that we have to make a decision, whether it's today or 2 days from now or 3 days from now. I don't think that anyone here who has expressed their opinion is going to change that. So I think that we as a board are going to have to set a time when we're going to come and we're going to make a decision. As a former school administrator, I know that the people who are in those positions want that. They deserve that. Parents and grandparents and other concerned citizens need to know. I do want to thank the superintendent because I think it's important. We know we're not going to make everyone happy. It's just not going to happen, okay? But I think it's important that we come as close to trying as we can, and I think this was an effort to do that. So I would hope that calmness would prevail, and you would please allow us the opportunity for every board member to have their concerns answered. This is a serious decision. Whether we vote yes or no, it matters. You know it does. You've heard. Dr. Burns needs an opportunity to come to grips with the possibility of that. We all do that. We need that. I have done my own research. I've talked to doctors, and I've been a part of videos, both for and against. And I'm still having a hard time. So, Mr. Chairman, I think we need to decide when we're going to meet, and we need to decide that we're going to vote.
Okay.
I thought
So-
we did. I thought that's what this was
No.
for.
Okay, so I sort of, so when I 100% understand where Mr. Dodd's coming from, and it's also on social media, because we did make a comment, we were going to bring, this meeting was going to be about fact-finding, but we did call it as a special meeting, therefore we could vote. I mean, so that we have an
But that was
option.
all done.
We don't have to vote, but because the fact it's a special meeting, but how many people understand Robert's rules and what the protocol is? And the last thing we want to have happen is for it to appear that we slip something in. I mean, because that's not the case at all. What we really want to do but I got to tell you the truth. I don't know that as chair, if we do this one more time, I may go an hour, maybe 45 minutes or something, because this, the public input, we've heard over and over the same things, and we get it, we get it. But from my perspective, I'm willing to accept a motion, or if you want to make a motion to table it for right now, and we give a specific time that we're going to come back. Does that seem reasonable?
Absolutely. Because, I certainly share all of your concerns that we need to come to a decision at some point. I guess I wasn't expecting that today was that day without
I understand.
But.
When is our next meeting?
Our next board meeting is September 13th. And as, well, that didn't get us to where I wanted to be either. So it's interesting. One of the things that I've been the most concerned about is the quarantine numbers and trying to have some reason to that. And we're not going to know that until the 15th. But I think we get this out of the way on the 13th, if that's what you need to make the motion, Mr. Dodd.
Yeah, well, I'm just kind of listening if that calendar is going to work. We good with that? Okay, then I move we table this particular issue until our meeting on September the 13th.
Okay. Do we have a second? Do we have a second?
I'll second for discussion.
Okay.
And I understand the hesitation. I feel like, and this, I feel like the argument's not going to change. The data is. I'm not going to say the data's not going to change. The data's been presented, and the superintendent has made a very reasonable attempt to meet an argument in the middle that there isn't a middle on. If I'm being frank, there's not a common ground, and it seems like it's a common sense meeting spot that would help. I'm being very careful because I agree with what Mrs. Cunningham said, that it's almost like the more information you get, the harder it is to make the decision, just to be honest with you. I do have 3 kids. I was responding to emails until they started to become just over inundated with emails. And all 3 of my children are in Lake County schools, Lake County public schools every day. And I want to make those decisions for my kids. I absolutely want to make those decisions for my kids. But you also cannot. There's numbers, and there's kids that are out, and there's things that are happening. And my own pediatrician that I've talked to, many people who have called me, is saying, we need to put masks on kids. But I've also seen the research on the types of masks, and I can guarantee you that my 8-year-old's mask does not come home clean. I promise you. It comes sweaty and disgusting and stinks.
So is the concern the timeline? I mean, because we could potentially hold something special before the 13th, right? I mean, aside from waiting.
Are you aware we had 500 kids with COVID in 2 days this week?
Absolutely, but I'm also aware of what we told the public. We told the public this was going to be a fact-finding meeting. We also sold.
I don't think we did.
We absolutely did. My other request was that a member of the health department was going to be here. We have no member of the health department. If they're refusing to come, that's fine. I want to go talk to them personally and have that conversation to get my questions answered, because I'm getting data from all these sources, and I need to reconcile that. My bachelor's is in political science, master's in education. I am not the scientist, and I need to go talk to the health professionals that are. I also have a concern that we received the superintendent's recommendation in writing at the beginning of her presentation. I have not had an opportunity to float this around, and one paragraph is based on a hypothetical if the law changes. So I think that we need some time to reconcile all of that. Although I will certainly offer the praise that to the superintendent's point that those of you that stand on one side and those of you that stand on the other side, you're never going to agree on this one. Totally get that. Totally get that. 100%. And this is not a mandate. This is, once again, still providing parents the opportunity to opt out of whatever decision is made. But at the same time, I do know from the transparency side of things and where just my own philosophies are on government to represent, I just feel like we've tricked people if we vote today when we told them we weren't going to.
I think that's definitely your perspective. That was not my understanding from the discussion at the meeting. But I just want to point out that Treadway, where is it? With 57 students, and we can't do anything about that. I frankly think that schools should be shut down until they are able to.
Please.
I'm sorry, excuse me. Last year, we had a policy that we all agreed to, that if there was 3 connected cases in a school, it would close a school down. We have 57 cases now, and nothing is happening. I
didn't understand the policy to be that last year. I thought it was a third. I thought we talked like a third.
It was like 3 cases. We've shut down 5 classrooms at Treadway, or more.
The challenge is if you shut down Treadway, to use that as an example, because it's one of the highest ones.
It is.
You still have 550 kids that what are they going to do that aren't quarantined or infected?
Yes.
We need to keep kids in school. That's what we need to do. Okay.
Phil, this is supposed to be our conversation.
Please. Ma'am, please be seated. Ma'am, you are not in New York City right now. You are in the South, and we don't treat people like this. Okay. Ma'am, I'm going to ask you to leave, please. Please.
This is a farce.
Thank you.
Try to take this country down?
Ma'am, please.
You're not going to do it. Because it starts with small people like me. I'm leaving.
Thank you.
Cops are getting sick from the COVID vaccine, too. I talked to the sheriff's department. That's mine.
Thank you. Okay.
So our policy it was 3 cases would close a classroom, 3 classrooms would close a school, 3 schools would close and the health department has told me we have never closed anybody, and I know the superintendent knows that they're not going to close the schools down, and I know she's worried about Treadway, for example. You know, like these are flat out outbreak schools, and then you're low at your lower levels. I would say above 1%, you know, or 2.
We have the principal from Treadway. Do we mind? She's asked to speak.
She is
Dr. King, Dr. Vanessa King.
Hello. All right, so we have a lot of cases at our school, and I'm not hiding that, and I'm going to put it out there for you. And I can only speak for what's happening at Treadway. I see the numbers everywhere else, but something has to change. Last year, we went with masks, and I'm not saying that's the end-all, be-all, but we did go with masks last year, and we had nowhere near the amount of cases that we have right now. I have a school that has 57 children with COVID and continuing to grow. It's not stopping. We have to do something. And I am begging you guys. I have begged my parents. I am that principal that's begging. Somebody said it. I'm the one that's doing it because I have a lot of cases. I've had 19 staff members out on my campus. I've got kids on my campus whose parents have caught COVID from them, and 2 of them have passed away. So that the other side of this is we're talking about masks and what might help or what might not help, but we're going to have kids that have family members that are not going to make it through this, and they're going to have those effects as well. I don't know what else y'all want us to say or want us to do, but I am going with the superintendent because something has to happen at my school. I don't know. I know the other numbers everywhere else, and I think it's a good plan that you do it per school. But right now, we have a lot of cases, and something has to be done. And I just don't know what it is. It may be masks. It may be shutting down some classes. We've had to do that. And Ms. Burns is up here trying to say this to you guys, and we have people going after her because she's trying to speak up for schools, and my school in particular. We need your help. We need the community to support each other instead of fight against each other, whether it's mask or not mask. I'm not either way. I wear my mask everywhere I go. I have not had COVID yet, and I'm at a school full of it. You know, everybody on my leadership team has had it at some point. I have not because I wear my mask. Not saying that that's not it. I might have some great immunities built up in my body. I don't know. I'm not the doctor. I'm not the scientist. But right now, I'm telling you that I do wear a mask. And if anything can happen to help my students on my campus, my families, to keep things from happening to them, I want to try it. And just give it a chance. And it seems like we have people that want to give it a chance. We have people that don't want to give it a chance. But we have to do something in our community. And I don't know what else y'all wanted me to say or if you wanted me to say anything, but I just needed to get that out.
Okay, thank you very much.
Can I just say, it's random. She did nothing Treadway didn't do anything wrong. It's just, it's going to hit some places worse than others. And we just need to start protecting our kids. And I stand with her. I stand with the American Academy of Pediatrics and the CDC. And that's what I'm asking.
Well, and my thought with that is, and I was going to ask Dr. King, and she left, so I'm just going to say, I know that at Eustis Middle School, they had a really high beginning, and now they're coming down from the beginning. And so that's why this plan makes sense to me, because as schools fluctuate, and so hopefully we'll see her school come down from the increase that she's had very soon. I just feel like this is a way for us to manage and help, schools feel like we're supporting them in this moment, but we're not mandating and we're not making it district-wide, because these numbers clearly show we have schools that are fine. And I found that strange. We've gotten emails about go to schools, talk to these people. I have been in schools. I have talked to principals. I talked to one of the principals that's on this list that's red this morning, and she said, we're okay. This is not a crazy outbreak, and she's red. And her face to my ears did not sound like Dr. King. So that's super interesting to me, right? But my thought process in that is, when being in the schools and listening to them tell me, I totally lost my train of thought, but there was a point to it. Hold on. Going into schools and so Eustis feeder patterns. Eustis Heights Elementary School was really hurting 2 weeks ago, the end of 2 weeks ago whenever I went in there. Eustis Middle School was really hurting. Eustis Elementary School was fine. Eustis High School was fine. And so when you think community, you think a feeder from Eustis Heights to Eustis Middle, but not Eustis Elementary, and the high school is okay. And so I don't know how we manage with a universal mask mandate for an amount of days or time. And I also think that we would get, we hear people talking about data in here, and that we've got to follow data, but man, you and I know controls are, they're so unstable right now, right? There's so many things that we could say.
I like
Right, but my thing is, we're going to see cases go up and down just because of people having it, not having it, wearing masks, not wearing masks, washing hands, not washing hands. That's going to be, there's so many different components that we can't nail down one. And so at least we're giving them an option to manage their school. Anyway, so I just I feel like it's a good flexible option. Mr. Dodd, you are definitely more politically aware, I feel like, and I missed the end of the meeting last week. I did watch Dr. Weiskopf's presentation on this school, the academic So congratulations, by the way. I wanted to say that in my comments. I'm not going to now because we've been here for a long time, but there's a lot of really good things that were brought up in that section. But I didn't get to see how the organic nature of this meeting, so I understand if it was communicated or if it was not communicated clearly, we definitely don't want to make a decision, but I don't want to prolong this decision anymore that schools are hurting. So if we can nail down a date and a time that we're going to meet like ASAP and we can put it out there and notify it and do it and not, I don't know if we're allowed to say public input or no public input, but like the decision is being made and it's going to happen and we're not leaving without a decision being made.
Okay.
Did we misadvertise this? I mean, like, what's the?
We did say a special meeting, and in our meeting, we talked about the idea that possibly we would have the court order reduced to writing by then, and that we would know the status of the state's appeal. And so because of all that hypothetical, we left it as our options to be open as a special meeting. We still don't have a judge's order in writing. So it seems like we can't.
Which we are still under.
So we're still under the status quo of the law.
That's right. And I agree with you. That was kind of how we left it, is that we didn't have the judge's order. We were hoping to have it in writing. That would have given us more direction if we had it. It was that conversation that could be misconstrued, because a special meeting by its nature is actionable.
That's right.
I mean, so we know it, but I'm certain a lot of the public probably does not know that. And
I'm just surprised we got such a, I mean, it seems like we got over 100 emails. Everyone's here. And I mean, I know you don't trust me. That's not
me,
my.
it doesn't come down to the public input at this point, because we've heard so much of it. For me, there's still the essence of, did the people know we were going to make a decision?
And that's all, right?
And that's where I'm stuck. So I'm not ready to debate the merits or the cons of the superintendent's recommendation. I'm just stuck on, I just don't know that this process was transparent enough for folks to know that, hey, a decision's going to be made today. So I'm fully prepared to come back and have that discussion, just with the public knowing we're going to make a decision. And I'm okay on escalating that timeline. I don't think it needs to wait till our next regularly scheduled meeting.
Yeah. And I think that, again, because this is so important that we move it quickly.
Sure.
We also, I think it's important that we do it in the evening. I mean, again, all this was kind of rushed for us to come together. And I guess this BCC kind of worked out pretty good, though, right? I mean, compared to our meeting room. Okay, well, we need to see when we can get it, and because that was one of the things that pinched us into this morning, was its availability. And so do you?
Is Monday night available? Is Monday night
Well,
available?
Monday is Labor Day.
Oh.
But can we find out some dates that are available next week, and we come together? Is that? And well, first of all, we need to make a motion to table this. Right?
So I think I've got a motion and a second for
and you got a
13th.
second.
So
Okay.
perhaps we need to
vote on that first,
because we don't know about the 13th as our specific day.
Or did you amend it? That was your motion?
Well, the motion, because
the motion was the next school board meeting, the 13th, but you're saying come together sooner.
And I'm perfectly amenable to and
you
I think
amend
would
your
be preferred to come earlier.
Okay, so you want to amend to the first available date?
So the first available date, and I guess we will leave that to the superintendent to correspond with the BCC, right, to determine available dates and come to us and properly notice.
Okay. And you want to second that?
Yeah.
You second the amendment? Okay. Any more discussion? All those in favor?
Aye.
Okay, 5-0. Okay, so we'll get back together as soon as possible at an evening meeting in this facility. School board comments will be limited to, I have to decide, but our Neola, just so everyone knows, is 30 minutes. And I need to think about what that's going to look like, because we've heard over 3.5 hours of public input on this. So, and we got 8 zillion emails. Okay, all right. Now we're down to what are we down to? I've lost my.
Probably be done too.
Where's my agenda? Okay, board member comments. Anybody?
No, the only thing I would say is we really do appreciate you coming to share your opinions on both sides, and hopefully we'll get a decision for you very soon. Thank you.
Dr. Burns.
For me, it's that I just want to continue to hear from constituents. I know we've heard a lot of public comment, but now that we have a recommendation put forth that tries to bridge those two sides, I'm just interested in hearing from folks, is maybe this isn't your ideal plan, but is this something that you could live with? I'd really like to be able to understand the two sides of that going into that. So I think a lot of our debate still centered on masks or no masks, but I'd really like to center it on what is this surgical approach and targeted in areas where there are high pockets of COVID spread and center our discussion around that. So feel free to continue corresponding. I'd really like to keep that focus.
I would like to say that when I went back and watched the academic piece of Monday's workshop when I stepped out around lunchtime, I really wanted to mention that when the enrollment or the absenteeism data was shown, and it was high. I mean, you guys all commented on how much more absenteeism we had last year, which was expected, but that the data showed that our students actually held their own. I mean, I know there was a decline, but it wasn't a significant decline by any stretch of the imagination, which to me communicated that we overperformed. Honestly, if we had that much of an increase in our absenteeism, but not a very significant at all decrease in student performance, it wasn't a testament to how hard students and teachers and administrators were working in this county last year due to COVID. And I know that we're continuing that, it's due to the efforts that everybody, I heard Ms. Smith with LCEA say everybody's tired and everybody's working and conditions have to give, but I will tell you more than ever, I do feel like people are coming together. So all of the administrators that I have spoken to, because that's one thing the people I've been trying to listen to the hardest are the people that are with our kids every single day and leading the buildings in this pandemic. And they are saying that their people are amazing and that people are working hard for kids and kids are amazing. So I just wanted to reiterate that. I didn't get to say that last week. And I promise you that I was here this morning. I was stuck outside and we couldn't get anybody to answer their phones in this building. So thank you. That's it. Except you. You answered your phone.
Right? Very quickly, I want to tell everyone that I know absolutely how hard the superintendent has been working on trying to come up with a plan, because our main obligation is to keep our students and our staff safe, but also we have to keep these schools open, folks, and not doing anything is not an option, So in an effort to do that, hours you spent, and then she would run something by me, and then ultimately, I will tell you right now, her proposal is more than is real leadership, and it keeps our schools open. It immediately addresses those hotspot schools without district-wide. Everywhere across the state, you're seeing where school boards are debating to mandate district-wide. And in this case, all we were doing is surgically picking schools, quarantining them. Once they come out of the red zone, they go back to optional, and that is fair, folks. I mean, Jiminy Christmas, if you're talking about threading the needle and meeting the needs of our kids and keeping kids in school, that's the mission, keep kids face-to-face. The other issue is, and by the 15th, which I hope y'all will grant another emergency meeting, right now the Surgeon General and the CDC and World Health are at odds about the distancing. So any kid that contact traces within 6 feet has to be quarantined. It should be 3 feet. That is the health department has recommended that. We would cut our quarantines in half, and again, we have to have kids in school, period. So that's the next big hot button for me, that on the 15th, there's a new Surgeon General. We're told by a reliable source that he's going to immediately be discussing this and taking it on. And so it would be nice if both of those could be wrapped together in a bow, but it can't. We're going to have a couple days. But no, I know of my heart of hearts that in today's meeting that I thought we were going to vote, but I understand 100% the whole misunderstanding. And it was something I could vote for. I'm just telling y'all. I don't disagree with you about taking the mandate part out, taking that paragraph out. The rest of the document I could have supported. Anyway, so I do appreciate the civility. Again, one more time, I want everyone to know, if you've watched school board meetings across the state, they've not been like this, and that's a true credit to this community. I had a call coming in that I guess Osceola had a meeting last night where it got physical when people were throwing stuff. and they were scared for my safety and want to make sure we had police. I want to thank our security team, Mr. Carr, and your folks, and the Sheriff's Department, that actually the people have kept this in check. And so this is a compliment to y'all. So, all right, Superintendent.
We have some of our school leaders here today, and I want to thank the district staff and school leaders who have worked with me on really trying to come up with something that, understanding that we want to protect the rights of parents, but first and foremost, we want to protect our kids. And so they've been instrumental in contributing to the conversation and collecting their thoughts and ideas. I want to thank those of you who were able to be here today, and just thank you for all your help. And we are Team Lake. Thank you.
I got a fast breaking. If Mrs. Baxley, if you can get with Dr. King real quick, someone's going to donate N95s for all your teachers. So y'all can hook up right now. Okay? Okay, that is outstanding. And that's what a community is about, by the way. So thank you. Were you done? I'm sorry. Okay. Mr. Johnson? Okay. With all that said, meeting adjourned.
Recording stopped.